You wanted to go over the phrase. Go over what the phrase "doing an exam" means.
Oh, I think when we have patients call in, we'll kind of generically say they'll ask me, "What is he going to do? What is he going to do for my condition?" And the answer is usually, he needs to perform an exam, and then we'll let you know, sort of thing. And I think, from what I've heard, that hands-on looking at the patient, touching the patient, moving things, challenging things doesn't happen. So when we go and do just a standard neuro exam,
what you consider to be a standard neuro exam
right,
is not the
textbook
standard
neuro exam. We're looking at cranial nerves, like, can you balance left side versus right side? Do your eyes move left? Do they move right? Do they move up? Do they move down? What is the nuance in there? Can you smell in your left nostril or your right nostril? Do you know what those things are?
Yeah.
That's what I mean about doing an exam. So
detailed.
I think what people have to understand is we're going through all of that system, all those systems in the body that otherwise take in sensation of who and where you are in space, and trying to itemize them and say the things on the right do a really good job, but we fall short on the left. Let's say the face is a little bit more droopy, or the eyes don't move a certain way, or you can't smell certain things. We're simply taking a lot of time, asking a lot of questions, gathering a ton of information so that we can better understand how they relate together. Okay. So all
right, so let's just do it this way. Instead of all this prep, if I ask a question you're not comfortable with, we'll just say flag that. Just tell me we're not using that.
You know the rules.
That's all.
Yeah.
I forgot.
Yeah.
That's how
so
we
anything,
do it.
if you start to say something you don't like or whatever, just say flag that. We'll take it out.
Okay.
If I ask a
right?
question you guys don't want to address, or I ask it in a way that doesn't feel right or is inflammatory, we'll flag that.
There you go.
If you have to pee, just tell us.
Okay.
We can pull it out.
Are you recording yet?
I did start, yeah.
Okay.
I did start.
Did you want to touch on C-sections and the importance of...
just C-sections or just the importance
of...
Well,
or after birth, yeah.
Yeah. Yeah, we absolutely can.
Seeing, okay.
Ooh, I like this.
Torticollis and all that. Like,
yeah, just the trauma of birth.
Our last patient yesterday morning.
Yeah.
The importance of a vaginal birth.
Okay.
All right.
Yeah, we had.
Yeah, as my son was a vaginal birth, but a lot of my nieces and nephews were all C-sections.
Yeah.
But this can be pretty inflammatory, depending on, because I'm pretty passionate about this one. So
good.
Okay.
Listen,
inflammatory.
Birth is not a medical condition; it's a natural process, and we intervene way too often.
If you're okay
and there
with
are
the
embers,
then.
I have no problem being inflammatory.
Okay, then all right.
And as the producer, that's what we want.
I'm just gonna let you guys talk. I mean, I'm just here to guide you.
I'm the measured one.
He's the more calculated.
Well, you reel her in if you feel you need to.
I'll be like,
we need the engagement, right? So the whole adage, no press is bad press, right?
Yeah.
So even if they're talking about, how dare you do blah blah, they're still talking.
I'm just very protective of my guests, though. I always like.
Truthfully, the difference between the two of us is what allows us to be successful.
Okay.
Because her passion for what she does gets results.
Yeah.
And
us women are fiery, man. I'm telling you.
And
telling
you have to be.
Yes, we do.
Yeah.
They're sun babies. All right.
All right. We'll let you guys play good cops today. Jamie and I will be on fire.
There you go.
I need a shot of whiskey for that now. I'm gonna bring out my fire. Oh my God. I'm dry. I'm going to catch on fire real quick.
Well, you're sitting across from a Sagittarius during Sagittarius season.
Oh, jeez.
It's all fire.
Yeah. We just came out of Scorpio season.
Nice. I'm a water sign, too. We'll show you guys that.
There you go.
That's why I'm so dry. We just came out of fire.
That was a wild month.
Whew.
That Scorpio season was wild.
Yeah. All right. So you're already recording, so I can jump in whenever.
You guys are ready to go. But okay, so please speak directly into the mic. You guys, this is picking up the whole thing.
Okay.
So it's fine. We're in a small space, so the voice carries, so we're all good there.
Okay, cool.
Yeah, but if you like just at least face the microphone so that everything's going in there, we'll be good.
Oh, here's a dumb question.
She's
I've
the one
never
that
said
was-
your last name before.
Sacco.
Sacco? Okay. It's always Jamie or Dr. Jamie.
Yeah, that's
okay.
but that's what I go by. So
Dr. G.
yeah.
Sacco.
All right.
Okay.
Don't get me.
I hate when we do that.
I
And then
know,
it's
don't
like,
look
no,
at-
we got to chat
Don't look
again.
at me. Don't look at me. How you look? Yeah.
All right, yeah, we'll just jump in. All right, so episode 7, Ida the Fifth, and we're here again with Dr. Andrew Brodyn and his lovely other half, Dr. Jamie Sacco, is joining us today.
Round of applause.
Yeah, thank you guys for having us.
And Lubert's here,
Hey guys.
as usual. So, episode 2 was a hit.
It was cool.
I'd say.
Yeah,
I think you helped a person or two,
quite a few.
or 30.
Quite a few.
Small handful
Yeah.
at least.
We had some really cool, interesting cases come out of that. Everybody that made a lot of headway did a ton of work. So the people that were like all in to kind of use a bit of our guidance and help themselves are doing awesome. So we have somebody that we worked with remotely that basically we touch base once a week. We gave them a bunch of stuff to work on. She came in after she was better, drove all the way from New Hampshire to show me that she was better, and I was like, this is awesome. And we spent like a ton of time together. She's back to work. She's
Normal function.
yeah, we're getting there. So like
That is awesome.
super cool. And it's interesting because I mean, I like being hands on, and this was one of those times where I didn't have the opportunity to be hands on, so we had to be really creative as to how we handled it and what resources they had and what we could do and what the parents could help with and stuff like that. And she did awesome.
But the important part with that is that they were 250% compliant and did everything you told them to do, when you told them to do it, how often you told them to do it, and that's why she got the results she got.
Yeah, weekly updates. I mean, they would itemize their exercises, how many repetitions, at what time, what was the result, how did I feel, and all that feedback was just tremendous. It was like
great. And I tell people all the time, having been through it myself and the people that I've coached, it's like that is key. Consistency and repetition. If you're going to get on the path of healing and you're serious, then you have to. That's key.
For sure. Yeah. I think we're conditioned to believe that there is a modality, a medicine, a supplement, a something that's going to do that work for us.
Right.
And you see it all over, like some of the forums. They're like, well, I need vagus stim and I'll get a vagal stimulator. I'm like, yeah, that could be helpful if that's the problem. That might not be the problem though. So you might, but so I think the people that are fully invested in the work get to where they need to go. And I think that's cool. We're just kind of act as guidance to get them there. So,
right.
Yeah.
So tell me what an exam looks like exactly. What do you mean when, I know people call you all the time, and that's probably the question you get most, or to start with anyway, is what are you guys doing?
Hey, you
So,
normally field
I field more of the new patient calls, talking to new patients, explaining what the process is, and the question is always, well, what's going to happen on the first visit, the consultation? And I always find that word to be interesting because it's not a consultation, it's an exam. You're seeing a doctor and he is going to examine you. But I think that is something that doesn't happen in standard practice. When most people go to see a practitioner, they spend 5 minutes with you, they ask you some questions, they look at a few things, then they send you out for blood work or imaging, and that's it. They give you your script and you're on your way.
Right.
What I try to explain to patients when they call in is that you're going to have a detailed neurologic and physical exam performed, especially like if we're talking about like the dysautonomic patients. He's going to look at every single cranial nerve, which there's 12 of them. He's going to look at their GI function. So we're going to listen to your stomach. We're going to feel your stomach. We're going to press on different organs, see what type of response you get. You're going to look for inflammation. You're going to look for how your body responds to certain stimulus. And those results tell us what's happening in your system. He's going to look at a sensory exam of your feet, of your hands, of your face. Can you feel this? Does it feel the same on the other side? It is so detailed and so thorough that I think it's hard to explain that to people.
Yeah.
And I always tell them exactly what I just said, but they don't understand it until they come in and they actually have the doctor do all that
Like,
and see how detailed and how thorough and methodical he is in his work.
Right.
That they're like, oh, nobody's ever done this before.
And I want people to understand that are listening, especially the people who are frustrated and have been stuck in the system for a while, chronically ill for years. It's hard to wrap your head around that after seeing so many doctors and even specialists and hospital visits where you do only get that 10, 15 minutes with a doctor. And your exam is so different. The first time I had one, I sobbed because I was understood. I felt understood for the first time in a 6 to 7 year journey. So yes, that exam is something special that you guys do. It's totally different.
And I think we're taught in school that you don't typically have enough time, right? So most exams are taught to be target focused. So that's become kind of accentuated everywhere else. You're like, my knee hurts, so I'm just going to look at a knee. God forbid we look at anything else, sort of thing. And so in cases of functional dysfunction or issues of function, I want to hear what the patient has to say. I want to hear what your previous diagnoses are, and then I like to put them on the back burner and say, okay, this is what we think it is. Now let's look at everything from a 30,000 foot view and itemize all the data and say, what is where? Is this correct? Should we be looking at other things? Could there be other things that play into this problem? And like we were talking a little bit before, and how you were saying, I want to know, can you smell with the left nostril? Can you smell with the left? Can you figure out what it is? Do your eyes move left, right, up, down?
Yeah, and I assure you there are no doctors asking those questions out there.
Yeah. And we want to know the nuance. So typically your imaging exams and blood work and all those things, they're gonna show you true pathology. You're gonna have infection, tumor, bleed, all those kinds of things, and they're necessary to do. You got to make sure people are safe ahead of time, and that's I love when people have gotten that done ahead of time, because it saves us. Yeah, it's more data.
You've ruled things out.
It helps. Yeah, it helps take all the scary stuff off the plate, and then we can start looking at the things that don't show up on imaging, like changes in function.
Right.
You know, you could think about like a simple example. If you go ahead and take a walk and roll your ankle, your body has self-protective mechanisms that maybe lock up some of those muscles. So over 5-6 weeks, that ankle can heal. But if you never learned to move that ankle again, now all of a sudden we have a differently moving ankle compared to the other side. And over time we have knee pain, hip pain, back pain. And we're like, well, I got back pain. Well, how did it start? And so we want to unravel that onion a little bit and say, like, how did this happen?
So I want to just touch on something real quick that you said. When a patient calls in or they come in, they're like, well, so I was given this diagnosis, and you're like, okay, that's your diagnosis. A diagnosis is simply a name for a collection of symptoms. Right. And when patients call in and they say, okay, I have dysautonomia, I have gastroparesis, I have, whatever the diagnosis is, they ask about what happens on the first visit, but then they say, well, what's the treatment? Right. And I laugh whenever they say that a little bit, because I try to explain to them, it's a process. I have no idea. Because just because you have a diagnosis of dysautonomia or gastroparesis or POTS or whatever the case, your treatment is specific to you. Right. How you got there and what's wrong with your neurologic exam is not the same as everybody who has the same diagnosis as you. Right. Your history and everything that your body has been through is completely different. Yeah. And sometimes there's similarities. More often than not, there are similarities, and I always explain that to people. Usually there's a visual thing. Usually there's a vestibular thing. But I don't know what your treatment's going to be. And you can until you have the exam. Yeah.
And you can think of some of the therapy as, we'll call it teaching opportunity. Let's say we have a nervous system ahead of us, and that's the student, and we're trying to teach that nervous system something. Not everyone learns the same. Sometimes we need different stimulus and different cueing to have a nervous system or a patient respond to a type of treatment. So we might change the speed of which we do something, or the intensity at which we do something, or the number of repetitions. We may raise their heart rate prior to doing something, just simply to make it pay attention. And then we're taking all those things that we found. Let's say we have a loss of bowel sounds, gastroparesis patient. After we do some intervention, I'm going to go and listen again, because I want to know, did we get some bowel sounds from this? If we didn't, we either have to change it, or we have to think of it a little bit differently. And I have to know that that's happening in order to keep going in that direction.
Can I ask you, for the people who are listening who have gastroparesis, how did they get there?
Whew. That's a loaded question.
I mean, what is the cause? Is there a specific set of things that happened that caused that to be the result?
Like what's happening in the body?
Yes.
Oh, okay.
Is it always preceded by trauma?
No.
Okay.
No. We've had patients that have had surgeries like Mall's surgery or whatnot, where they move diaphragm, they sever a ligament, and whatnot, and in those cases I've seen scar tissue play a structural role in kind of preventing certain things. So you look at the scar, and it's like the skin around it is unbelievably pale. It never gets pink if you rub it or whatnot. So we know we have a blood flow component in that area, and it's the scar tissue. So we work on that sort of thing. Okay. You can have people with vagus nerve dysfunction or whatnot, where the nerve simply doesn't transmit adequate impulse into that area to allow the stomach to empty. So
why is it not?
So it can be from head injury. It can be from
certain chemicals.
Chemical injury. It can be
as in medication.
It can be.
Okay.
And vaccination, which we've seen.
But also, I'm thinking of the big gastroparesis patient, like the very, very first one that came from Steph.
Oh, and cannabis. So.
Oh yeah.
So.
Yeah.
That was an interesting.
That's more rare, though, is it not?
Yeah, it is, but it does happen.
It happens.
When it's
for all my fellow cannabis people, it's
overused.
rare.
It is
overused. It has to be.
No, it's an abuse, right? Like,
It's too much of a good thing, right?
Yeah.
So it was.
I think people need to hear that.
Yeah.
You can abuse
today.
cannabis,
Yes,
people. You
yes,
can.
So
everything in moderation.
There's a condition called cannabinoid hyperemesis syndrome, and basically what you end up with is too much THC, and what it will give you is symptoms of restricted blood flow, internal hypothermia, and vomiting. But what you end up with is poor blood flow to the trunk, which makes you super, super cold. And then when you put food in, there's no blood flow, there's no movement in that stomach. So the only place it has to go is up rather than out.
Amazing.
Yeah.
There are so many people listening right now that need this education.
Yeah,
I mean,
absolutely.
what you're saying is so important.
It's
so
good
important.
for the health of everyone else, right? Like,
Yeah. Just quickly, we may have touched on this in episode 2, but vagal nerve stim. When is it appropriate? When is it not? And how do you feel about the implanted versions?
If I had to choose, I would choose external stimulation over others.
Before you go any further, the reason I asked this question too is there are so many stimulators on the market now, but we touched on it before, how people don't understand the metabolic limit and how you can overdo it. And
and here's the thing, with any type of intervention, it should be temporary. So to have it implanted in your body for something like this, granted, like we're not talking about like a pacemaker or something like that, that's like a life-saving thing, but if you have some type of condition where vagus nerve isn't working, it needs to be rehabilitated. You don't need to have a crutch implanted into your body, because there's something else going on that needs to be treated, and it eventually will cause too much of a good thing. It'll cause a problem. Too much vagal stim is also not good.
Yeah, there's a lot of ways.
Thank you for saying that, because it's true.
Yeah, there's a lot of ways to stimulate the vagus nerve. You can do so via stimulation of the inside portion of the ear, where a portion of that like auricular nerve is most superficial, so you can electrically stimulate that. You can do it via humming, gargling. You can do electrode stuff around the neck. You can even do coffee enema, which will do those kinds of things. So
that stimulates the vagus nerve?
Oh yeah,
because it goes right to the gut. How does that work?
it irritates the lining in there, and it stimulates that sort of emptying.
Okay.
So we had, or I know of someone that loves their coffee enemas.
Yeah, I know a few people who really love
It's probably the same person. So
Oh, yeah, it probably is the same person.
but on the other end, what happens is that they fall asleep everywhere all the time. They're so rest and digest that they're never awake. So
I know some people like this who are not doing coffee enemas. What is another reason for that?
Narcolepsy.
I mean,
that are falling asleep quite a bit?
I have a friend who I thought was on drugs. He looked like he was nodding out. He's just a sleepy guy.
One thing that we've seen a bunch of, especially post-COVID, is that kind of idea of brain fog or whatnot. And one of the things that we'll use is what's called a red desaturation test. And we'll have somebody look at the color red with one eye versus another. I think you and I have talked about it. But
I have this issue.
The retina is super sensitive to changes in blood flow and oxygen. So when you look, let's say, at the Christmas stocking, you say, okay, that's fire engine red. And then I look with the other eye and I'm like, oh, that's kind of plum. It gives us some insight that retina is not receiving adequate flow. And we can then correlate that to the rest of the exam and say, I think we're not getting enough blood flow to this head, therefore not enough oxygen to this head, and people are feeling spacey, foggy, disoriented, have some disequilibrium, and a whole bunch of other stuff. So that's yet another thing we'll take a peek at, is kind of that vascularity aspect of, are you receiving all the things you think you're getting up there?
Right.
You know, I think we think of, like, it's easy to think of chemistry, right? We're like, oh, do I have all the acetylcholine I need, and do I have all my dopamine and all that kind of stuff? But there's more. There's do I use those areas? Do I have good blood flow? Do I have underlying conditions like diabetes, heart conditions, other things?
Yeah.
They all play into how well we move fuel around the system. And the more...
Describe what you mean by fuel. What
fuel meaning blood flow, bringing oxygen and sugar to the areas that need them. So you're an adaptive system.
Use me as an example. So I have desaturation in my right eye.
Yeah.
How would you go about treating that?
So we would look...
I actually do, everybody.
You do.
Just
Well, we have a finding, though, so we can give you a treatment. We have some type of clinical finding.
So in your case, super neat. So we have this persistent red desaturation on the right side, which kind of gives us an indication that we don't get good blood flow into that area. So we can look at it a couple different ways.
And you can talk about my case. I had the spinal cord injury and stroke. And go ahead.
Yeah. Wow. So
tell everybody what a weirdo I am and what's going on.
No, I think you're pretty awesome.
You're a miracle of science.
Your stuff changes pretty quickly. So I'm not married to a particular type of treatment, but I will look through kind of like an itemized way. We'll look at structure, we'll look at the blood vessels, we'll look at activation, we'll look at all those kinds of things. And then we'll keep checking in on that red desaturation and say, are we making a change over here? Did the thing that I thought was going to help, did it actually do what I think it was going to do? So we may listen to, let's say you're carotid, and we're listening for brewy or turbulent blood sounds. We may be palpating the pulses of your neck underneath your collarbone, along the armpit, along that area. Listen to your heart and things like that. So we want to know those heart sounds are good. And then we can look at it simply from a chiro standpoint up front and say...
Funny you say that, because just as you were saying that and ending it, I was going to say, for the people listening who want to say, you're not a doctor, you're not a real doctor, you're a chiropractor, which is such bullshit.
We're a doctor of chiropractic.
Yeah,
and
exactly.
Dr. Andrews specifically has a fellowship in vestibular rehab and has studied how many hours in functional neurology. But
right, and I
not
love
a
that
medical
we're doing
doctor.
this, because between episode 2 and now listening to you, I think people will get, you actually know what you're talking about.
I do. And so there's we have to look at all of the anatomy that lives in that area, right? from a chiropractic standpoint, chiropractic is a tool, and I only think of it as such. I don't think it's this miracle treatment. It can be if it's used appropriately, just like every other tool. People get results from massage and acupuncture and somatic work and chiro and a whole bunch of different things, but it's all in how you apply your tool to the person in front of you. So
it's great to have a whole toolbox. Yes.
Yeah. So in your case, we're looking at that red desaturation. We're saying, like, what is the pathway of the blood vessels as they leave the heart? Well, on that right side, they're going to go up and under that collarbone and then up into the neck. So we're going to look at the collarbone. Do you have excess muscle tension in there? Do you have like a pseudothoracic outlet syndrome happening there? We could look at neck muscles like the scalenes, the pec minor.
Is your first rib elevated?
Exactly, whether the first rib is elevated. There's a whole bunch of things that structurally can squeeze on other
I
structures.
think I have an extra rib. I've been meaning to ask you that.
I don't know.
There's like this much space between my pelvis and my I don't know. It's weird. We'll talk
Well,
about
you
that
could.
later.
It does happen. You
Yeah,
can have
we'll
an
talk about
extra
it later.
We do have a patient with extra bones.
Yeah, you could have an extra lumbar
Extra lumbar,
segment.
extra
You can have,
cervicals.
it
Yeah,
happens.
I was
Yeah.
told I'm missing part of my pelvis and part of my skull, and I think I have an extra.
You're a
Extra
congenital
ribs.
Oh,
anomaly.
they put it in there.
I am. I'm super weird in
It's
every
in your
way.
rib. That's all.
Sorry.
I'm actually missing the palmaris longus tendon on both sides, and they say that if you have one congenital anomaly, there's a likelihood that you have another.
Okay.
So it happens. I mean, so my grip strength
Not to
isn't
go
as
too
good.
far off topic here, but empty cella syndrome. Do we want to talk about that at all? Because I happen to. That's part of my picture as well. Is it actually crushed? Is it? I mean.
That I'm not sure, to be honest.
Yeah,
I
I
don't.
have my theories, and I just don't know.
I
what to
have
think
my
about it.
theories too. I have another person that I'm working with that sort of thing, and we're working through it. So we're looking at those same like red desaturation tests, and your carotid arteries come up your neck, and they end up in what's called the circle of Willis.
Yeah.
And that circle of Willis surrounds the pituitary, which sits in that cella turcica. So the question is there a problem with structure? Was there a problem in delivery of fuel to that area, so that area didn't thrive? There's a whole bunch of things that
I've been leaning structural and in myself. Yeah.
Maybe.
Well, knowing that you have some other structural anomalies, that is very highly likely.
Yeah, and it was interesting when I brought up the empty cella to my neurosurgeon. He did not want to talk about it. He was the one that brought it up at first, and then my next visit with him, when it was on the screen and I brought it up, he said, "Who said you have that?" I said, "You did." And then he changed the image on the screen. He didn't want to talk about it. So do they have their own theories?
I don't know. I don't know what their perspective
And my
is.
wonder too, if it's part of my overall picture, could it have something to do with the psychic phenomenon, and that is a part of it? Could that be why he didn't want to? I don't know. Anyway, yes, I have multiple theories around it.
It's possible.
I don't know there.
To go back to something though, while we were talking about desaturation, I want to talk about the eyes. I know I've mentioned many times publicly in relation to functional neurology, eye exercises. So I'm sure people have called you and said, "Steph sent me here and she said we're going to do some eye exercises." What the hell is she talking about?
Yeah. So the eyes give us a huge window into how certain areas of the brain work. The eyes themselves and their alignment in the skull can tell us a lot about how muscles are behaving around those eyes. Muscles don't operate on their own. They are under the direct control of the nervous system. So if we have a change in what the muscles are doing, we have some insight into that nervous system saying, like, why could this be going on? So we'll look at eye movement to try and rule out big things first. Can you move your eyes? Do the muscles work? If not, we may have a bigger problem. I may have to send you someplace else because we may have a tumor, a bleed, something that's impacting the function of the nerve as it enters that muscle, and those can be big things.
Yeah.
I think it's important to understand, because this is one thing that patients don't understand, because they look at eyes. When you talk about eyes, they see an eye doctor. My vision's fine. What do you need to do for my eyes? I have my vision is perfectly fine. It's 20/20 or whatever. It's degeneration and I have slight changes in my vision.
Yeah.
Vision is not the same thing as what you're talking about right now.
Correct.
The movement of the eyes is different in how that correlates with the brain and the function of the system. Vision plays a role, but there's more to the eyes than just your vision.
Yeah, I think that's where the education needs to be, is the importance
And
of
there
the eyes.
there are more causes of blurriness than simply dryness. So we can have the eyes are awesome because if you look inside them, it is your only availability to look at the blood vessels directly in that system. And so if we want to know what's happening inside that brain and what those blood vessels look like, looking inside the eye with an ophthalmoscope gives us some insight. We're like, okay, that artery doesn't look so good, or we've got debris or spots. They will lead us towards things like increased intracranial pressure, diabetic conditions, a whole bunch of things, and this is where you're going to see them first.
Okay, so that brings me to, and this can help people, many people who will have these questions, intracranial pressure. What causes the fluctuation? There are a lot of people out there that believe they have a leak when they don't. They have this fluctuating pressure. What is causing that?
Oh, it could be a lot of different things. So you can have trauma. You can have a space occupying lesion, meaning a growth or excess CSF in places it shouldn't be. So you can have normal pressure hydrocephalus. You can have elevated pressure hydrocephalus. All those kinds of things. So there's a lot of things, and basically what you're seeing is that there is something behind the eyeballs pushing directly on the retina, showing us inflammation and pressure. And so you see kind of a widening of that area, and you go like, hey, there's something pushing on that directly. You can see it with inflammation. People that are like really not doing so good in that department, it's a possibility. You can see it with elevated blood pressures. You can see stuff inside the eyes too. See just like pulsations, things like that.
So can we tie this into asymmetry in any way, or
this is the beginning of chronicling that asymmetry. Yeah.
So for me, I didn't know I had hydrocephalus until 6 years ago. I was at the end of my rope. It was right before I found this field of medicine, actively dying as I was. And when I went in, they wanted to do an angiogram, and I asked him about hydrocephalus, and I had not been diagnosed before. And he went over my scans again, and he said, sure enough, you do have extra fluid at the top of my skull. So
normal pressure?
I had actually had a spinal tap and blood patch. I had a fluid leak after my spinal cord surgery. So this was found maybe 5 years after that, 4 to 5 years after that. Closer to the spinal cord surgery, I was having pressure issues. My vision went crazy.
Yeah.
Around the leak, I was going blind and I couldn't sit upright. It was bad.
Pushing on the retina.
Yeah. Yeah. But at that time, I felt like my pressure was stabilized. Everything was fine, but they saw the pocket of fluid at the top of the skull. So I don't know.
So when in certain cases, when you have volume loss, or if you have a change in the size of the brain, you still have to fill that space. It's not a vacuum. It's not an air bubble that exists in there. So it gets filled with CSF and blood. So people that have had tumors removed or large pieces of brain removed, that's not vacant space. It gets filled in. And that's what we have. And so in cases where it's simply filling space, we would call that hydrocephalus, because you've got more fluid in there than you would expect to see, but it's normal pressure. So because it's simply occupying that space without pushing on other structures. So there's
I have to say, I do sometimes feel like I'm underwater. Like my vision will get pretty bad, and that's the best way to describe it, is like I can't clear it, and I just feel like I'm underwater. So, Anyway, I'm a weirdo. We're not going to go into my whole case history today. I'm just using some examples to go here. I did want to ask you.
If I can
Yeah,
just
go
jump
ahead.
back.
Go ahead.
So going back to, we were talking about the eye movement stuff. We were talking about looking inside the eyes. Different types of eye movement are driven by different parts of the brain. So if I have you put your thumbs out in front of you and then snap your eyes back and forth between your thumbnails, those are called saccades.
Right.
They're fast eye movements. So when I move my eyes to the left or jump them to the left, my right frontal lobe does that. So that's a window into how well do you push that eye quickly to the left. Now, if we go and take that thumb and we move it side to side and you track it with your eyes, there's a huge component of the parietal lobe that helps with that. And that's the sensory part of the brain. So it's just another tool for us to be able to say, like, hey, sensation is lost on this side of the on this side of the body. We would expect the opposite parietal lobe to be a little bit funky. How far has this gone? Has this also impacted the integrity of those tracking eye movements? And so again, we're collecting information. We're saying this side versus that side, this structure, not that one. And we want to make our target as small as possible when we're doing these treatments, because it's way easier to aim, rather than bombarding people with a bunch of stimulus and just hope something works.
Yeah. So
We're at 36 minutes.
okay.
Wow.
To add to that, I know a lot of people who end up chronically ill have exhausted, they're financially, a lot of them are going bankrupt because this country, let's not go there.
I mean, it's a capitalist.
So I happened to be in a very fortunate place when I was as ill as I was. I got to go see some top expert, well, was I lucky? Perspective. Anyway, I got to see a lot of what many would deem experts in this country. I went to Hopkins, had some very respectable doctors. And towards the end of my journey, my neuro-ophthalmologist wanted to send me for eye exercises. Now, how does that relate? And the reason being, at that time, my dysautonomia was out of control. My POTS was awful. So that was the reason he wanted to send me, and it sounded foolish to me. I'm like, what could my eyes possibly have to do with everything that's going on? So how do the eyes relate to, how do you help somebody with POTS using the eyes? What does that have to do with POTS? Because there are many people out there with dysautonomia and POTS who are going to say, there's no way some eye exercises are going to help me.
So I'm really glad you asked me that, because I've been thinking about that the last couple of days. Is our system is designed to adapt to stressors, right? Our brain also has to make predictions as to where am I and am I safe and all those types of things. In order to make that judgment call, just sitting still, you're going to take in information from a ton of different systems. Touch, facial sensation, hot, cold, sharp, dull, all those kinds of things. Where am I? Where is the horizon? Is my head balanced? What are my muscles telling me about the position that I'm sitting in? And you have to make a judgment call about that, right? Am I safe? And in this scenario, sure.
Yeah.
If you were to, let's say, move, right? You're going to get up and walk to the door. Mm-hmm. There is a change in all of those systems. There's a change in your head position, so that vestibular system. That vestibular system is very highly correlated with what you see. There's a muscular change. There's a gravitational pull of blood down towards the extremities. And so we have a ton of reflexes, and we have a ton of little elegant mechanisms that help us adapt to those tiny changes. So when you stand up, you create demand for blood flow. How good are you at getting blood to your legs? If not so well, that may look a certain way. If it's really, really efficient, you may pop up and run.
Right.
We should have the ability to move resources around our system efficiently and quickly without having symptomatology associated with
Right.
it. So when you think of like a POTS patient, when they get up or they change position, the problem they're having is moving resources from one area to another. They're either not happening, they're happening too slow, or the way that they're doing it is causing symptoms. So we can, let's say you're super stressed, you need to get up and go. In order to make my heart beat faster, I can decrease the amount of oxygen in my system, right? I can move more, makes my heart beat more to move stuff around.
Yeah.
I can raise my respiration rate. I can breathe faster, and whatnot, and change the chemistry in my system, and that'll have a similar effect. So overall, we are constantly taking in information from all our sensations, our visual system, our inner ear, the tactile sensation of our skin, of our head, face, body, all those cranial nerves we were talking about before, and those things help us predict what to do next. So in a lot of our POTS patients, we'll look at those things from a different perspective. Let's say we're saying like they're having trouble bringing blood up to their head when they change position. How good are they at knowing where their head is in space? What are those neck muscles look like? Are they really rigid? Because that's a problem.
Yeah.
How well do those balance centers work? Because that balance centers tell you where your head is in relation to your shoulders. If that's not working so good, that may be a problem. How good are you at feeling where your face is? Do you have no sensation on the right side of your face? If you have no awareness of where the body part is, it makes it really difficult to get resources to. So, and we wouldn't otherwise know that that's happening until you look. Right. So a lot of times we'll do like a sensory exam, and I'll rub one part of the face and another, and say, does this feel like that? And then they look confused, and then they go, wait a minute, no, it doesn't.
Yeah.
And you wouldn't know, because your nervous system won't lie to you, and
Right.
it's not going to tell you things. You just adapt and you live and you take in the information you've got.
Yeah.
So
you can't interact with your own nervous system.
Right.
So when you touch your own face, you don't know.
Yeah,
it my finger
there
or
is
is
a
it my head?
perception issue. Like
Yeah.
I noticed, when I went through the treatment myself, it's like so many people who are chronically ill will say, I have this symptom, that symptom, and they think it's stemming from somewhere. I'm like, it might not be. It probably isn't. I think you're perceiving it wrong.
Right.
And that's may sound offensive to them, but it's like, no, it is skewed, and you need to go.
Well, because their neurology
out.
is skewed at that point.
Right,
So their
right.
understanding of their body and how it's working, they've compensated things
Right.
to a certain point that they don't really know what normal is.
Exactly.
So how can you expect them to understand that it's abnormal?
Right.
I think we have a tendency to assign meaning to things that don't necessarily have any. So you can be, especially if it's something happening internally. Like I've dealt with severe anemia in the past, and
Personally.
yes, for me, cold hands and feet, hypothermic, shivering, brain fog, fatigue, racing heart, all those
Dizziness.
kinds of things, dizziness.
Is that a malnutrition issue? Mostly?
That was a self-induced malnutrition issue. I used to
Okay.
train for triathlon, and I had a dietary coach that kind of had me eating very little and a lot of the same thing over and over again. I did that for a year and then ended up in a really bad place.
I'm asking for the people who out there who are anemic, is it an easy fix like diet, or is there something else that's behind that? Is it multifactorial like everything else and nothing's easy?
Yes.
It is.
Yeah.
Okay,
Well,
fair enough.
We can come back to that one.
But what you were saying before, I did want to touch on for the people with POTS who just listened to what you were explaining. I guess the question, it would be more important to point out that you understand the workings and have an answer as to how to correct the things that are going wrong versus how did they get there. Because
I don't always have an answer.
Right.
Yeah.
We don't really
We don't know. Chicken or the egg.
Yeah. So I guess the important thing is that you understand and are doing an exam unlike what they're finding elsewhere. So.
And I think Dr. Jamie and I have tended to co-treat many of our POTS patients, and I'm good at looking at the nuance of movement and sensation and those kinds of things, but when it then comes down to the chemistry and underlying conditions, that's where I defer to her to do more testing to see what other factors play a role here. You can't look at one without the other. If we're talking about moving fuel from one area to another, we want to know that we can do it, and then we also want to know that it's adequate, right? So there are other things like underlying infection and things like that that can deprive us of the integrity of that fuel that will also drive these things. So we have to look at the whole picture chemically and physically. Yeah.
Do you find that, how does this relate, like your brand, how does it relate to men and women? Because men and women are completely different, right? But neurologically, are we all the same?
I would say no. I would say no.
Well, that's an interesting question and answer. Please expand on that.
And also, like, oh well, yeah.
I find
Women are tougher, obviously.
Yeah.
no. I was
Obviously.
I hate to turn into
Who wants to arm wrestle right now?
This is not gender wars. I just wanted to.
I'll speak to the trends.
Right.
But my female patients push harder, try harder, do more
Duh.
over the male patients for sure. They can tolerate more discomfort, whereas the male ones, like, I mean, if the paper cut happens, game over. It's like,
Yeah.
No. And is that based on maybe because men don't really talk about what's wrong with them?
Yeah.
Right? So we can't, like, you know, you're like, oh, well, how does this feel? Or it feels like this.
Oh, yeah. Condition
a
not
man,
to.
Yeah, a man is not going to, this all feels the same.
You also know based on how they fill out the paperwork, because the female patients give you every detail and tell you the whole history,
Right.
and the men is everything like not applicable.
Nah.
Yeah.
Like
NA.
NA.
Yeah.
But then when you actually sit down and you talk to them, they're like, oh, I didn't think that
Right.
related. And, you know, whether it's like a personality thing or whatnot, I also think like typically in alternative healthcare, and I say that with air quotes because I hate that I have to say it that way, but that's what it's called.
Yeah.
You typically have a higher prevalence of female patients because female patients are typically looking for alternative answers. They're typically more actively seeking like alternatives for their health and improving things. I mean, look at like husband and wife. The husband only goes to the doctor because the wife makes the appointment, you know, because he's doing other things and you know, working, taking care of the household, making money, things like that. But I think it's like partially a society thing because men are not allowed to look weak. So they kind of just like suck it up. Right. And not that women aren't weak, but we're like allowed to. And I think that's part of it. So like if you're a male patient and you're struggling with these types of things, we can help you with it, but you have to talk to us. You have to tell us what's going on. Otherwise, we won't be able to help. And you can get help. There are answers for you other than just medication.
Right.
Yeah, I agree with you there. I feel like our male POTS patients are tougher because they act tougher.
Yeah.
And they keep more to themselves.
Exactly. Like
Right.
I'm in the business of trying to have as much detail as possible all the time, so that I can tweak whatever it is that we're doing, and I can't extract that information from many of.
It's probably helpful when the male patient has a wife or other half with
Yeah.
him who
She
is
answers
probably
the
like,
questions.
no, he's wrong. This is really what's going on, and gives you all the details.
Well, that was the point of this, right? We want to put that information out there, right?
Yeah.
Hey, men, something's going on, but you have to talk. You have to let people know. If not, you're never going to get better. Or find alternative medicine. Or
let's normalize men being able to share their feelings and
or
all
what
that.
they're feeling, right? Like,
or just simply paying attention.
Right.
You know what I mean? Like, it's very easy for me to just feel crappy throughout a day and just be like, well, I'm going to stuff that in the background. Everything's fine.
I'll be all right tomorrow.
Yeah.
Exactly.
Yeah.
And you get to it when you get to it. Yeah. And I find that with our male patients, we get to it later. And then there's more to deal with because a lot of stuff was shoved under the rug.
Yeah.
Or we'll have situations where they'll come in and be like, I'm really fatigued. I fall asleep in the car all the time and I end up in the middle of the intersection. This is really scary. And then I'll ask a question like, how's your blood pressure? And they're like, I'm not here for that. And I was like, but you are.
Yeah.
You know? So it's that kind of thing. It's kind of like, I want to steer people away from like single factor thinking. Just we're not just limbs. We're not just super specialized bits and pieces that walk around. We're a very elegant integrated system that has a lot of detail to it, and we have to look at all those things.
All right. Can we bring this around to gut health now? I know we wanted to touch on the poor understanding within conditions and
Speaking of men.
and the relevance within neuroimmunity. Where do you want to go with that?
So I think the term gut health is like a trendy term nowadays. You know, like you hear it on all these commercials for probiotics and like all sorts of things. And just as much as we talk about the importance of the brain, the gut is equally important because you've probably heard of the gut-brain axis. Yeah. And those two systems are so highly integrated.
And how the gut is the second brain.
Exactly. Yeah. If the gut isn't functioning well, the brain isn't going to function well. And if the brain's not functioning well, it controls the gut. And then the gut's not going to
You hear that, everybody? For the people in the back?
They're connected.
Can we say that
So the patients with dysautonomia that have gastroparesis or constipation, diarrhea, bloating, stomach pain, all those types of things, the GI stuff could be causing some of the dysautonomia symptoms, or the dysautonomia from like a previous head injury, a concussion, a car accident, whatever the case is, could be causing the GI stuff. But when we talk about gut health, there's all this like trendy stuff that we were talking about, probiotics and like all this stuff to just kind of help improve gut health. It's not so simple, and that's the difficult thing for people to understand, is that you really shouldn't just start popping probiotics. Now, a perfectly healthy individual that doesn't have any issues, sure, your system's adaptable. You can try things without having an adverse effect. Right. But if you have an underlying condition, something that's inflammatory, you have tons of GI symptoms, you really should see a provider that can evaluate you and tell you what you need. Specificity, just like we were talking about the neurologic exam. Specificity matters, and probiotics are good, but again, too much of a good thing's not good either. Yeah. And you can't just arbitrarily throw certain strains of bacteria into a system without understanding what your own microbiome looks like. Right. Go ahead.
And to your point, when we prescribe probiotics, it's with a purpose. So if somebody has an underlying candida infection, right, overgrowth of yeast, we will use strains like Saccharomyces boulardii, which you're not going to see in most of your store-bought probiotics. Why? Because it's a direct competitor to Candida. And so I'm introducing something in that system that is going to negatively affect the infectious process, right? So I can take all the lactobacillus and all the other ones that I want. It may not have the power that you expect it to. So if you're really careful about giving the right strains at the right times, they're tremendously effective.
Yeah. Absolutely. So I used to be big into probiotics when we first started practicing, using them a lot to like repopulate the gut. And over the years, I've realized through like my own research and my own practice that it is actually more effective to understand which of the bacteria is the, in air quotes, bad bacteria, meaning it's opportunistic, it's overgrown, it's too high. And it's more important to check that and bring those levels down, because your body will re-regulate and repopulate when you've kind of killed off those bad things, like yeast or certain like strains of aspergillus, which are like mold species or fungus, Clostridium bacteria. And some of the testing that we do in the office would be like a urine analysis that's going to look at like the intestinal microbiome, and it's going to tell us all the different strains of bacteria in your gut, or not all of them, not every single one, but a large majority of them, the kind of super important ones, where those levels are and which ones are high, which ones are low. So we can take certain supplements that might kill off certain bacteria, bring them down to a more appropriate level so that your body can then re-regulate. And then from the other perspective, one of the most common things that our GI patients, when I say GI patients, they come in with GI complaints. They've already seen a gastroenterologist, they've seen their primary care provider, and the number one thing that patients are taking is an antacid. So they're on omeprazole or Nexium because they have, acid reflux.
Yeah.
So fun fact is that acid reflux is
tell
actually
people.
not due to too much acid in your system.
I tell people this
It's
all the time,
actually
drives me
due to
crazy.
the fact that the acidity is low, which acidity can be
Yep.
low from excessive stress, poor diet, an imbalance in the microbiome, and
SIBO, H. pylori,
yeah,
whole bunch of
tons
things,
of tons of different things that can cause it. Taking an antacid, which shuts off acid pumps, majorly impacts your overall health because acid is used to digest protein, but it's also a second line of defense for your immune system. So if acid is low, you're not able to fight off foreign invaders. So when you're exposed to a virus or a bacteria, you suppress your immune system because that acidity kills those things off.
Yeah.
And acid is so important, and it's so interesting to see so many patients coming in on omeprazole or Nexium, and not only like just having taken a round of it, they're on it for 20 years.
Yeah, thank you. So important what you're saying. My
read the
dad, my
box.
brother have been on antacids for years.
Yeah, if you read the box
They're
warning
bleeding.
on
My
Nexium,
brother has to sit upright to sleep at night or he's vomiting blood.
That's a big problem.
that's a huge problem. But
Yeah.
the
box.
box warning
Pops
says
them
not
every day,
to
though.
exceed 14 days.
Oh,
Yeah.
Oh, he's probably
14
on
days.
3 years straight. Yeah.
We've
And
had
they're on
taken it.
40 milligrams a day. They
Holy
basically
crap.
produce no stomach acid.
Right.
And then initially, so that protocol of taking like the Nexium or omeprazole is really helpful for a patient with an ulcer. You have an ulcer in your stomach from whatever the cause is. You need to reduce acid so the ulcer can heal. It's a temporary fix.
4 days.
No, it's up to 2 weeks. Up to
Yeah.
2 weeks to
Yeah.
kind of like reduce it. I mean, sometimes a little bit longer depending on how bad it is, but it's not a long-term fix. And most of the patients who take the antacid, guess what? They eventually need to take more and more and more and more and more.
then
So
they end
you're
up-
not.
Then they end up constipated
Yep.
Yeah.
because the protein that goes in cannot be digested. It's not digested anywhere else but the stomach. And if
Right.
you don't have the acidity, that's a problem. When protein sits in the GI system,
so
it
important.
putrefies.
Yes.
And it rots. And so all of a sudden we have these inflammatory bowel conditions and things
Yes.
like that where you're like, my stomach hurts, I can't go. And as silly as it sounds, will walk people through the process of reacidifying the gut, and all of a sudden they're
there
like,
are
hey,
so
it's
many
better.
people out there in the chronic illness community who have gastroparesis, who are chronically constipated, myself included. Back when I was sick, I would go up to 9 days not moving my bowels. That makes you crazy, okay? First of all,
Yeah.
besides being very uncomfortable
I
and
cry.
all
It's
the
actually
other
not
things
the
that
worst
happen.
I've heard. I've actually had a
Yeah.
patient where when I asked when she wrote constipation on her paperwork,
Yeah.
well, how often do you go? She's like, oh, maybe like 3 times. I'm thinking 3 times a week, a month.
Yeah. Well, what these
times a
people
month.
aren't, but these same people are also fighting for their rights to pain medication and stuff. Well,
Right.
those pain meds are constipating you,
Yes,
number
they
one.
are.
And then they're also taking antacids and other gut medications because they have gastroparesis. And they're not looking at that picture like, maybe these medications could be actually a bigger driver in what's going on here than the condition itself.
And your ability to empty regularly tells us how well that detox process works. So
Yeah,
the one
yeah.
thing that Dr. Jamie says to her patients, if you're not going regularly, you're not a candidate for detox yet. Why? Because you can't empty the toxins you're releasing. So we have to fix that first.
Yes.
Speaking of detox, so all of the people who have the MTHFR mutation and are acting like that is their big problem, what do you say to that? Like, it doesn't have to be. I mean, I was diagnosed with all of them: MTHFR, like the
CYP30. like all those-
A1298C, C677T, COMT, whatever the other. Yeah. I had the whole alphabet. those things don't seem to be an issue like they used to be. So for the people who are thinking that's really clouding their picture or whatever, what do you have to say about the detox in general?
So when it comes to like the MTHFR stuff, I always tell people all this genetics research is still new. It's still being researched. So there are, when you have like an MTHFR or like a genetics test done, you'll come up positive for a ton of different things. And most of them, when you look at the significance, it'll say like not understood yet or not fully tested yet. So science is like constantly looking and trying to research and understand stuff. Yes, I think some of it does play a role, but it's not the be all end all.
Right.
The more simple, straightforward things are like, are you, and like I say this to my patients all the time, and I talk about it all the time, if you're not going to the bathroom every single day, at least once a day, but realistically at least twice, you're not well. Your body's not healthy. And at a certain point, you have a buildup of toxins in your body.
Yes.
So
that's why
again,
I said
when we
it
talk
will make
about
you
like
crazy.
when we talk about gut health being trendy, detox is another trendy thing.
Yeah.
So everyone's doing a cleanse or they're doing a detox or they're whatever. Your body has everything it needs to detox naturally itself.
Right.
You shouldn't have to be like doing a cleanse so regularly if you're healthy. If you are not a healthy individual and you've been through like a lot of different you have a chronic condition and you've been through a lot of different things, you have a buildup of toxins from whether it's medication or whatever the case may be. And like on the other end of the spectrum, we as a society are constantly exposed to a high level of chemicals and toxins in our food and in our water and in our environment. So it's not like it was 100 years ago. We're constantly being exposed to toxins. We are bombarded all the time. So yes, we need to do things that help improve detoxification, but detoxification is not just a matter of like taking a pill that makes you poop. If that pill is making you poop, but you don't poop on your own, then there's a problem.
Yeah.
And that's something like people don't want to talk about that, but pooping is completely healthy. It's something that we should be doing normally and regularly, and it gives us a really good indication of what our health is. If you're not eliminating, then you have no business detoxing. So we get a lot of patients who are like chronic mold patients, Lyme patients, parasite patients, candida issues, all sorts of things. And they're like, well, I've been taking binders, I've been taking all these things that helps me helps me detox. But when you ask them the question of when they go to the bathroom or how often, they're like, well, I go, like once a week, every other day. You have no business detoxifying the system if you're not eliminating.
Right. Yeah, and there's crazy video out there. I don't know where I saw this. I don't know what it was, but somebody, might have been one of those My Strange Addiction things, where somebody would go to porta potties and stick their head in there to get high off the methane gas. So I'm only using this disgusting analogy because if somebody can go do that to get high, imagine how you're feeling if that internally, if you're backed up that way, it is toxic. It's
make you
methane.
Sick.
Like
eventually,
you're gonna feel crazy
when you're not eliminating. You are going to reabsorb those toxins through your colon. So they're going to end up crossing through into the bloodstream, and you're going to reabsorb that stuff. And certain toxins our body will store, and they'll store them in adipose tissue, which is fat tissue. So why does your body store excess adipose tissue? It's because there's so many toxins in your body that it's trying to save you. So it stores it, especially with chronic mold patients. Chronic mold patients who are overweight or they have excess adipose tissue, they have a lot of toxic buildup stored in their body. And that's the chronic mold patients who are, and I say this with air quotes again, the healthiest, the most able to function are usually overweight because their body is efficiently storing the toxins rather than having it circulate and affect their heart and their lungs.
Wow.
So the chronic mold patients who are leaner, have less body mass, they're typically sicker because they're constantly recirculating the toxins. So our body is inherently intelligent. It's trying to protect us.
Divinely intelligent.
And that is a good thing.
That's the craziest thing I've heard.
But
is
that
very
is a really
interesting.
cool thing with like chronic mold patients is like you can have the same test results and one of them is like relatively fine, maybe they have fatigue, but they're overweight, they can't lose weight no matter what they do. And then the other one is very lean, very sick, cardiac, respiratory stuff. They're not storing toxins, they're constantly recirculating them.
So interesting.
We had a really cool case, and I love this patient. She's awesome. But we had a patient that came in with vertigo. We'll call it vertigo. And they had run her through the gamut, put her on immunosuppressants, had her taking prednisone, Cellcept, a whole bunch of
She was on like 10 different medications.
pretty heavy duty meds. Now, while this was happening, she became increasingly anxious or whatnot, so they ended up putting her on Klonopin and all those kinds of things. So I was really lucky to have gotten her when we did, because she was at the point with her ENT that they were like, we're gonna do chemo and we're gonna just knock out the immune system.
What was the diagnosis? Autoimmune inner ear disease.
Most
affecting one ear.
That seems to be the
ear.
go-to now is like IVIG for all the autoimmune patients.
And it's interesting because autoimmune issues are symmetrical and bilateral.
They're
so
systemic.
She's having issues in one ear, right? And they're like, it's autoimmune. I'm like, wait a second.
Let's look in your ear.
Let's look at some stuff. All it took was looking in the ear, and it looked like moldy bread.
Oh, wow.
And there was puffballs and all kinds of stuff in there. I was like,
wow,
this is fungus. And it would make sense.
We ran some testing.
We ran some testing.
To see what her intestinal microbiome looked like.
Sure enough, mega aspergillus, mega candida.
Wow. I have to do my oats test.
Yeah.
Yes,
you
do.
do.
To do it. Yeah.
So it was really awesome. So we said, all right, pause. Let's tackle this and see where we're at. I've had her since April. She's back to work. There's no vertigo. There's nothing.
We treated the mold.
Her ear is
That's
clear.
great.
It's no longer inflamed. We're off all medication, and she's slowly cycling off the Klonopin at the moment because she's decided that I've already gotten this far. Let me just fix it all, and I'll deal with the things that already cause me anxiety. She's amazing.
Wow.
So, I mean...
That's
super cool patient.
And that's
but
so important.
She was so compliant and did everything we
Everything.
told her to do. She was here when we told her to do it, and she got results. That is the difference.
Yeah.
And I think what I've seen a trend in with some of these practitioners is that if one pill didn't work, take two.
Yes.
If two didn't work, take three.
Yes.
And at some point you have to go, maybe this isn't it. And I think people want to keep upping the ante to something more serious when it was pretty obvious to begin with.
Right.
And it was just like, they don't typically test for those conditions.
Obvious to who, though? I mean, obvious to you.
Well, all you had to do was look. It was
Well, they're not taking the time to look.
maybe, but
They use different testing, and their testing doesn't look at the functional changes. We're looking at the function of the microbiome and how that plays a role.
Yeah.
And the way we do that is very different than like a gastroenterologist does.
And I just had a friend reach out this week to ask for your number because she's not getting any help with her vertigo. So I hope
that's my jam.
I hope she reaches out because, as you just said, there are multiple.
Yeah,
and there are things you're looking for that maybe they're not looking for elsewhere.
I think it'll get better when people start to realize that doctors, for the most part, are just reaching out for money, right? Like, get paid for this pill, I get paid to do this.
Yeah, I mean,
I'm sure
in big part,
there's a sales,
part.
there's a sales part of it, and
to a certain extent, yes. But honestly, a large part of it is more so like I don't even place the blame on the doctors. It is the way our society views health.
Right.
Everything is symptom management, and everything is based off of how much can you produce. There are so many sick people in this country because we have no idea how our body works.
Right.
And this can go back to like educational system, not to go like too far down a rabbit hole, but we spend so much time learning things that are completely irrelevant.
Yes.
How come we're not learning all about our body and how it works so that we can understand our own body and we can advocate for ourselves?
Yep.
You can
too much power.
You can tell a patient
Self-soothing.
can come in and they can have a diagnosis of like liver cirrhosis. They don't even know where their liver is. They have no idea.
Yeah.
So it's a huge problem. We do not understand our own bodies, and we don't know how to advocate for ourselves.
Yes.
Because we leave it all to the
doctor.
doctor.
We
Yes.
outsource
And we
it.
just we outsource
We
it,
have
and we
all been taught to place our trust in doctors.
Yes.
We have lost our own power. We've given it
Yeah.
away to that. And just recently a friend reached out to me and said, so-and-so is dying. He has cirrhosis of the liver. I go, so-and-so is sitting in the bar 7 days a week.
Yeah.
And if so-and-so would stop doing that, he could reverse that issue.
absolutely.
I
We
mean,
do-
but we all want the quick answer. We want the magic pill.
And habit change is hard.
Yes.
You know,
people don't want to do the work. It's not easy. And this culture now, our society is set up for instant gratification. We have microwaves, we have fast food, we have DoorDash. Everything is set up instant.
And-
If you have to do work, people will. It goes against the grain.
Yeah, and
know?
I used to have like a mentor, and one of the things he used to say is the body you currently have is the one you've earned by the choices you've made. And so, and it's a
That's a good
really
one.
tough thing
It's
to
a tough
hear
pill to swallow,
because
but
you're
it's
like,
so true.
this is my fault. Well,
Yeah.
maybe
Yeah.
to
Yeah.
a degree, there are some things that you could do differently that would
Right.
improve the quality of all the things you want to fix.
We've normalized things that should not be normalized.
Yeah.
We all have big comfy couches now. We all have iPads and laptops and phones and Netflix, and we're not getting off our asses.
We
and we don't
don't
spend the
move.
time in nature anymore.
How did my couch
Yeah.
catch us?
I mean, the Japanese, you look at the Japanese people still, I mean, they're squatting all day on their floor. They don't have big couches like
They
we
also
do.
live to be 100.
They're 100 years old, still squatting. It's phenomenal. We're doing it all wrong.
Yeah, and-
Absolutely.
and
78.
just to the simple stuff, like if we jump back to eye stuff, we have when we have light come into our eyes, if it comes from the bottom, right, it hits the top part of our retina, it hits what's called the dorsal stream, it activates our parietal lobe, and it tells us the where, and it tells us the what does it feel like, and then the light that comes from the sky hits the bottom portion of our retina, which is that ventral stream. It goes through our temporal lobe, which gives us an indication of time and helps us manage circadian rhythm and stuff like that. So we have these like all of the things that we would otherwise do naturally are so far outside of what we do normally that going back to simple stuff can be a really cool way to
Yeah.
fix it, you know?
Yeah.
Like
And that's what I love about this field. It's so educational. You're actually teaching people what's going on in their body, and that is what is missing, and that is why everybody is so sick.
Well, and I think in this field, the time that you take with each patient
Yeah.
is what causes results.
It's magic. It's where the magic is.
That's where it is, right?
Yeah.
Because anybody I've ever talked to, they're like,
Yeah.
how long do you say they spend with them? I'm like, 8 hours a day, 5 days a week. A doc with 8
Yeah.
hours a day. Like,
and the thing is you're with me.
yeah.
Right.
Yeah, I'm not passing you off to an assistant. You're with me the whole
Right.
time.
Yep.
So
But that's in our practice.
yeah, I know.
That's not in all
Yeah, that's
alternatives.
not-
True.
Yeah.
That's our practice. And
That's the secret sauce over here.
Yeah.
Yeah.
And I did do a special intensive that
Yeah.
was getting a doctor off the ground to start his own practice at the time. That's
Yeah.
why he spent the 8
Oh,
hours a
okay.
day, 5
But
days.
still, I
He
did.
has since cut that down, I believe, to 3 hours a
Yeah.
day. But
Yeah.
Even that. But even
still,
that.
even that,
Even
what
that.
doctor is doing that?
I
Nobody.
have a hard
15
time with
minutes.
it because I feel like I've spent so much time looking and learning at these things. Why am I going to give it to somebody that doesn't study these things and doesn't look?
Yeah.
You know what I mean? Like you can help me with certain things, and obviously you can coach and teach and all those kinds of things. When it comes to like the nitty gritty, you're
You're the
kind
doctor.
of investing in my time,
Yeah.
and I want to make sure that I have the best use of that time possible. And me
Yeah.
pushing it off just for me to be comfortable is not a good use of my time or theirs. So
All right. Well, we can talk
Yeah,
forever.
I mean, yeah.
But we got to keep this in a certain
that's
time where
okay.
people, attention span these days.
Dr.
Everybody wants to get back to
Dr.
Netflix.
Jamie,
Well,
Give us
I
Sacco.
want to touch on Lyme because I've had a lot of people ask me if we could talk more about it. Let's talk about the prevalence of patients with co-infections, and I would like to ask you your thoughts on Lyme and why are so many people
it's ticks.
why is it
Not
taking
necessarily.
I know.
yeah, why are so many people taking so long to get diagnosed? And when they get diagnosed, how do you feel about the treatment protocol that is out there? It is very expensive, and people are finding they have to find a Lyme literate MD to get the proper treatment. But in my personal experience, that was not the proper treatment.
So with getting the appropriate diagnosis, like finding out that you have Lyme, how come it's not something that's tested? Because the symptoms of Lyme are so vast and widespread that I think that in like you go into the emergency room because you're having one particular symptom. Maybe you're dizzy, or maybe you're passing out, or maybe your stomach's bothering you, and they're looking for structural changes. This is something that we talked about before. It's a functional change. It's some type of, it's an exposure to a spirochete, which is a form of a parasite that you got from, food poisoning. You could have gotten a tick bite. Not just ticks, they get a bad rap. You can actually get Lyme from any type
Mosquito.
of insect that bites you.
Yeah.
That was exposed to the Lyme virus. So a mosquito or a spider, anything that can bite you can expose you.
Okay. Good to know.
Yeah, yeah. Or food poisoning, like, you can get it from eating something that was not cooked properly.
I'm going to Mexico this week.
So I think
I'll be back for parasite protocol.
I think, and you know what? You say that jokingly, but honestly,
oh no, I'm not joking.
we should.
Do that.
Parasites are not something that only happens in third world countries.
I'm probably
it
full
happens
of them
here
right now.
all the time.
Yeah.
And when we were an agricultural society, we used to deworm ourselves, just like we do our animals.
Yep.
You take your animal to the vet and they get heartworm. Yeah. We live in the same environment as them.
Those cats
Why
lick
do
our
we think
faces.
that we're not exposed to it? It's not this like gross thing that only happens in, third world countries where they don't have proper
Water.
sewage and whatnot.
Yeah.
It happens. We can be exposed to it here, and most people here. I think like the percentage is somewhere around like 80% of the population has parasites. They just don't know it.
You hear that, everybody?
We should be cleansing ourselves of parasites.
Nobody's
going to
sleep tonight. They're like, I'm
maybe
full of
twice a year.
parasites.
And there's a lot of parasites are one of those things that's like new and up and coming, and people are understanding more about it. There's more research about it, so there's like some information out there that suggests that maybe certain types of parasites are also part of our normal microbiome too, and maybe they're opportunistic and they overgrow because they are a living organism and they lay eggs.
There
and
are
those
tribes
eggs
out
hatch,
there living
and they're-
harmoniously with these things
Absolutely.
forever.
So what's the factor? Why does one person, you can have two people go out to eat the same thing. One person gets food poisoning, the other one doesn't.
Yeah.
Is that one that had the food poisoning on an antacid?
Yeah.
And they don't have high stomach acid, so they can't
Yeah.
fight it off.
Yep.
Are they under an excessive amount of stress, so their immune system is suppressed? Did they take a ton of antibiotics as a kid, so their microbiome is a mess?
Yeah.
There's a lot of factors that play into it. So
Wow.
you asked the question of like chronic Lyme and why patients aren't getting diagnosed early enough. It's because it's not an easy thing to diagnose. Sometimes the blood work does not come up positive right away. You have to know whether you've been exposed, but it's hard to know whether you've been exposed.
Right.
And chronic Lyme is a thing. Any condition becomes chronic when it's left untreated.
Right.
And that's the difference. An acute versus a chronic condition.
Can I ask what is missing? So the people that are being put on months and months of IV and oral antibiotics and whatever else they're giving them these days, what is wrong with that? And what is the answer maybe instead of doing that? And at what point do you cut that off and say, this is not helping, this is not the answer? What else could they be doing?
So I think you should cut off anything that's not working after a normal amount of time. So a couple of weeks, maybe a month of doing something, because those types of things, sometimes you get worse before you get better. You kind of have to ride it out a little bit. But if after a month of treatment, it's not getting any better, you probably should change what you're doing.
Right.
I also think that the treatment for it with antibiotic therapy, the research suggests that it has to be given within X amount of time of exposure. And that's the hard part, is that most of the people who are being diagnosed with Lyme are diagnosed 6 months, a year, 2 years after exposure.
Right.
The antibiotics aren't going to work.
Right.
And to
I'm
the same
so
effect,
glad you just said that.
to the same effect, it's a spirochete. It's a parasite.
Yes.
Antibiotics would indicate bacteria.
Right.
Yeah.
Right.
So
They're not anti-parasitic.
they're not
Right.
anti-parasitic, So
Right. And then all the viruses that come with it. Also,
Absolutely. The
antibiotics are not
co-infections.
going to treat your viruses.
Antibiotics do not treat viral infections.
Right.
Period.
Thank
End
you.
of sentence.
Thank you.
Antibiotics are not the one-size-fits-all
And then
treatment for some type of condition.
The other layer to that being, antibiotics are they or are they not glorified mold? And if you have an underlying mold issue,
Yes.
are we now compounding that as well?
Yes.
Oh, don't get me started on this one. So,
Okay. Well, I won't. I mean, I'm just saying.
No, but you did. The fire's
There,
burning.
poke there.
Get
So,
him. Get him, Dr. Brodyn.
so something that is unbeknownst to most people is that vitamin C, something that you think of as a
Yes,
wonderful
is
immune
mold.
support,
Well, yeah.
is expensive to produce appropriately.
Okay.
But it's very cheap to produce if you
This is
have
so important.
aspergillus generated. Black mold produces vitamin C. And most of our store-bought vitamin C is derived from mold. And then you wonder, why don't I feel good? I don't know.
Yeah. Wow.
Yeah. Which
Yeah.
is
And they don't put that on the box.
of course not.
No.
Where they derive the chemistry from
Yeah.
is they'll never share that
They'll
with you,
never
but
share.
it's cheap. So that's
And I
where-
try to tell people this. They're like, well, you're not a doctor.
You're not a
And
doctor,
I can
Steph.
buy it, so you can't be right.
Yeah.
Okay?
You're better off getting it from your orange.
You can buy
than
heroin
lemon.
as well.
What's that?
I said you can buy heroin as well. That doesn't make
Yeah.
it right either. Anyway.
So yeah, so like it's interesting, and yeah, penicillin is derived from mold and
Moldy
whatnot.
bread.
Moldy
And-
bread.
Yes. And this kind of goes on to the topic of like fungus in general.
Nobody's sleeping tonight. I might have moldy bread in my ear. I have parasites throughout my body.
That's my body.
There are benefits and risks to everything. And it used to be that your provider would go through benefits and risk, and you would decide that the risk
Was worth it.
far outweighed the benefit
Right.
of the treatment. We've gotten to the point now that when somebody gets the sniffles, just to feel
Yeah.
emotionally better,
Yeah.
asks the doctor to prescribe an antibiotic.
Or a Z-Pack.
Right.
Yeah.
Yeah.
Is it bacterial? If it's not, then why? Why are you doing that to
have no
the
idea.
microbiome?
So to that effect, antibiotics, when used appropriately, can save a life.
Right.
You can have certain like bacterial infections that
Like
we can
staph
look at it.
infection.
Well, yeah, but we can also look at it from like a dental perspective. So the infections in your mouth, when you have an issue in your mouth, that is a direct link to your heart.
Oh, shit.
So that infection in your mouth can end up going directly to your heart, and you can end up having a bacterial infection in your heart that can kill you.
Right.
In which case, take the antibiotic.
Right.
Do the IV antibiotic,
Right.
please.
Yeah.
After that, let's work on your microbiome
Yeah.
and rebalance it.
Yeah.
And that's the other thing too, is that so many people take antibiotics 3, 4, 5, 6 times a year, every month, whatever the case is, because they have a cold, they have a virus. Again, viruses
Right. Are not
don't
bacteria.
work with antibiotics. Antibiotics
Yeah.
do not kill off viruses.
Placebo effect.
Yeah, exactly. It's a placebo effect. Like we said before, we want instant gratification. We want something else to make us feel better.
Yep.
We don't like to feel uncomfortable, but also society wants us to produce. We can't miss work. We only get
Nope.
3 sick days a year.
That's it.
So
Yeah.
we need to take something that makes us feel better because we have to be in the office
Right.
to, make money for the company so that way the company hits their numbers and whatever. And
Right.
then we're forced to like push through certain things when really if you're sick, you should stay home and rest.
Yes.
If you have a viral infection, whatever virus it is, it needs to run its course.
Right.
It could take 7 to 10 days to feel better. But
Yeah.
we're not allowed to take 7 to 10
No.
days to
Are
feel
you
better.
kidding me?
No.
We should be drinking water, resting, taking in like liquids like bone broth and eating light like fresh like fruits and vegetables, sitting out in the sunlight.
Yes.
Sticking our feet in the grass and
Yes.
grounding. All of these things are things that were like provided to us by the earth to help us feel better, but we're not given the time to do that. So part of the reason why so many people are chronically ill is because they're not given the time to actually heal. And that's the really hard part, because it's not that people don't want to be better.
Right.
One, they don't have the education to understand what's going on and what they need to do. And then the other thing is they don't have the luxury to miss that much work,
Right.
because they need to be able to pay their rent, pay their mortgage,
Yeah.
buy their groceries, especially nowadays because
The landlord
everything's
doesn't
so
care.
expensive.
Yeah.
Exactly.
Yeah.
And that's really unfortunate.
Yeah.
It's really, really sad. And unfortunately, that's why people end up with chronic conditions, because they don't get to take care of something at the moment when it's happening. We have to suppress things and suppress them, and we have to push them back and just learn to deal with it and take a medication to suppress a symptom rather than just treating the problem right in front of you, taking the time to treat it.
So let me tie that into, let's go back to the very beginning. Speaking of chronic conditions,
Full circle.
the importance of chiropractic care postpartum and for the newborn.
Okay.
Someone myself, I craniosynostosis is how you say it. I am part of my picture probably. Like things like that. How does that affect you long term? Torticollis. What do you see in this practice? Do you have newborns? Do you do that?
I do, yes.
Okay.
Yeah.
So the importance of all of that.
Our
Newborns
patient-
come
our
get like
patient
their
yesterday.
backs like.
So birth is a traumatic process, even when it's completely natural. Traumatic for both mom and for baby. You are literally pushing a human being, if you're having a natural vaginal delivery, out of your body.
Right.
They're being expelled into the world. So the birth canal is small, and that baby has to be squeezed through.
Yeah.
So that can be traumatic. You can end up, for the infant, having head tilts or misalignments in the spine, things like torticollis, where you have like a rotation of the head, which then long term affects things that Dr. Andrew talks about, like vision and vestibular stuff, because like these chronic head positions change the way you look at the world and how your body like moves and interprets things. So untreated, whether simply in the beginning it's just a misalignment of atlas, which is C1, the top bone of the spine, long term if it's left untreated, meaning you didn't take your baby to go see a chiropractor to just very gently adjust that segment, put it back into alignment.
And how important is that? That's
I was going to say, are you
in adults as well.
Are you suggesting right after birth, take your child to a chiropractor?
Yes.
Yeah, absolutely. So one of the best things that you can do for your child to help them thrive early on is have them adjusted. And people get super afraid of that because they think of like the YouTube videos that they watch where they see like the chiropractor
Popping,
doing the like
cracking Y
ring
strap.
dinger with the Y strap and all the we do not adjust babies like that. It is nothing like that. It is very simple, gentle, sustained contact. They don't have the same muscular tone that we do as adults, so we're not fighting past like tension. They're loose and relaxed. So it's just very, very simple. But realigning those things sets your child up for huge success in their health and overall growth and development.
Yeah.
So you said like
Synostosis.
synostosis. That's where you're going to see the babies wearing those like headgear things. You have bones in that make up your skull.
I missed my window from my helmet.
So those bones, when we're born, are
They're
not
still fine.
fused together. Our skull's not fused for good reason, for both mom and for baby, because like we said, the birth canal is small.
It's gotta
Baby
be
has
like-
to squeeze through it.
Yeah.
So when baby comes through the canal, a lot of times they have like a distortion of
Is
their head.
46 too late for a helmet?
I don't know.
Yeah, well,
My grandmother
Probably.
would say, put a hat on that baby.
It's generally
Right.
frowned upon.
so the bones
I'd
in your
wear it.
skull, just like the bones everywhere else in your body, there are joints in them when we're newborns, and they're not fused. And just like we can adjust atlas or the sacrum or any other like joint in the body, early on we can adjust those sutures to help with the alignment of the skull.
Right.
The importance and the significance of that is that if those sutures are overlapped or the bones of the skull are not in the appropriate position, when they do fuse, you're going to have abnormal growth of the skull, which is going to then
Impact
the volume of the
Right.
brain,
Yeah.
the
vision.
CSF,
Yeah.
all those structures and things in there. So that ends up becoming a structural problem that sometimes can't be overcome.
Yeah.
But early on, if it's treated before it becomes that, you don't end up with those problems.
Right.
But a lot of people are afraid to take their child to a chiropractor, or they just don't know that a baby can be adjusted. People think,
They don't.
I mean, we get a lot of patients in the practice
I didn't know that.
from
I just found that out today. What?
from a chiropractic standpoint, where the first time they see a chiropractor is like when they're 55, they've been in a
Yeah.
car accident, or they throw their back out.
Right.
I literally look at these people and I'm like, how did you live this long without seeing a chiropractor? And I'm a little biased when I say that, one, because it's my profession, but too, because I grew up under chiropractic care,
Yeah.
which is why I became a chiropractor. I think I was like 5 years old the first time I saw a chiropractor, and like I remember being a kid, like my mom was definitely like very like crunchy and alternative, and that's the way I grew up.
Yeah.
So like we'd be sick, she'd take us to the pediatrician, he'd be like, they have this, here's a script for this, and then we'd leave and we'd go to the chiropractor.
Yeah.
We'd get adjusted, and then we'd go to the health food store and get shots of like alfalfa or
Yeah.
something like that.
Yay, Jamie's mom.
Yeah.
Yay to being crunchy.
Absolutely. So, I mean, I am fortunate that I had a mom that questioned those things.
Yeah.
Right.
And granted, like, I have taken antibiotics in my life, and I have had, like, medical intervention in my life when it was necessary,
Yeah.
but it's not always necessary.
Right.
Especially with most of the things that we use it for. So, getting adjusted for baby after birth is super important for just setting them up for success. Helping them to, it helps with their growth and their development, which helps with their gait once they start walking, learning how to crawl appropriately, which those things and those milestones are so important for the development of the brain.
And how about chronic ear infections in
Yes.
children? How
So-
can chiropractic help with that?
Chronic ear infections
bring my
are
nephew
it's a multifactorial
Kids
thing.
always.
So it's like a microbiome thing. It's what they're being fed. Are they on formula? Are they breastfed? If they're breastfed, what's mom's diet like? All those kinds of things. But you can actually have chronic ear infections from misalignment of C1, which puts pressure on like the inner ear and
Eustachian
prevents
tube.
drainage. Of the eustachian tube. So you end up having fluid that gets stuck in there and it can't drain out.
Right.
So a lot of times, like babies who have chronic ear infections, once they start seeing a chiropractor, after they're adjusted and that C1 is put back into alignment, they actually have their ears drain out. And all the fluid that's built up in there drains out. And when that fluid doesn't sit in there, it doesn't cause a problem. So that would be the significance of that. And then you said like postpartum for mom, like I said before, birth is traumatic for both baby and for mom. Being adjusted postpartum is important, but actually being adjusted while you're pregnant is important too, because your body is literally growing a human being.
Yeah.
And the process of doing that, things change. Your sacrum has to move out of the way. Your pelvis has to open up. If you're out of alignment, you're preventing the growth and the movement of your own body, but also the growth of baby. So your uterus attaches to your abdominal wall, but it also has a ligament that attaches it to the sacrum. So if that sacrum is out of alignment and it's not being adjusted, you have a distortion and a change in the uterus, which prevents the baby from being able to move or having the room that they need. I mean, research suggests that women who are under chiropractic care have shorter, easier labors because their body's in better alignment. They're able to get through things a little bit better. They typically have a better postpartum recovery, and they also have a higher incidence of actually having a natural vaginal delivery because their body is open and adaptable.
And that vaginal delivery is crucial to the integration of reflexes. So we think about like, so babies have a reflex called the spinal galant reflex. So when you stroke their spine, it causes them to writhe. Now, when they go into the birth canal itself stimulates their back, which allows the baby to wiggle out. Now, kids that are delivered via C-section never have that opportunity and sometimes don't integrate those reflexes. So you see kids like we saw yesterday who diagnosed with sensory processing disorder, having difficulty with a whole bunch of things, behavior and movement and just kind of joint stuff. And all these sensory kind of manifestations. They want to rip their clothes off because it doesn't feel good, or they
It's
walk
really
on their toes.
sad to watch, and what mainstream is doing for these kids, which really isn't anything beneficial.
Just take them to the chiropractor. Give them a little.
And they walk on their toes, don't want to put shoes or socks on or whatnot. And yesterday we had an awesome little boy that came in. And we did a little bit of stimulation, and we based there are a whole bunch of exercises to reintegrate these reflexes. They're really easy.
So if you happen to need a C-section for whatever the case is, because sometimes it's necessary, there's some type of emergency that happens and it has to happen. So that medical intervention, although birth is a natural process that shouldn't have intervention when everything's okay, when something's not okay, that saves the baby's life or mom's life. So it is necessary sometimes, not as often as it's happening, but it is necessary sometimes. If the baby's not going through the birth canal, they're not integrating some of these reflexes. If that happens, you can take them to see a chiropractor, or a functional neurologist, and there are exercises that they can do post-birth to reintegrate those reflexes so they don't have a problem.
Do you hear that, everybody?
And after
Do you
the
hear that?
course of an hour,
Yeah.
the little boy, like I stroked his foot, and he went, "That feels good. Do it again." And so all of a sudden, his mom's standing there with her jaw on the floor, going, "Wait, what did he say?"
He normally can't wear socks and shoes. He's like fidgety because he just it's so uncomfortable.
It's so funny because I had one of my brothers. He was, 3 years old, and I remember I would spend like an hour trying to put his shoes and socks on, and this kid would scream and throw a fit and rip the socks back off if that line wasn't perfect across his
sensory
toes.
processing disorder.
Just last week, he sent me a picture. All it was a picture of his foot on the ottoman with a sock that was askew. And he's like, "I think I outgrew it."
I think we did it.
I laughed my ass off.
That's great.
And that, I mean, you think of like when you stroke the bottoms of a baby's foot,
Yeah.
their toes spread apart. That's the Babinski reflex. So
Yeah.
typically, as the front part of the brain grows, it inhibits that reflex. It prevents it from happening. And basically, it's the baby's first ability when it gets sensation to spread its toes and find balance for walking. Once we don't need that and other systems improve, I don't need that reflex anymore. It goes away.
That reflex should integrate by the time baby's walking.
I really want to drive this point home because there are so many parents. I would like to actually throw this at them after this is done. So many, I didn't mean that it came out wrong.
Nah, it's perfect.
What I mean is there are so many people who don't have an answer. They're taking their child and they're ending up with their kids on medications that I know they don't want to put them on, and they have a heavy heart doing that. And then there are all these things now in place where you can take your kid to an Eagles game, but there's a sensory room if you need it.
Yeah.
How about we actually fix the problem, address the
Sensory
problem,
issue,
and this is the field of medicine that can address the problem and give you some answers that you're not getting elsewhere.
And I mean, and just picture as an adult, if every time you put a sock or shoe on, your toes moved involuntarily. You'd want to get away from that too. You would do anything in your power to make sure that didn't
touch my
happen.
feet.
Right.
And in this kid, it was toe walking. Of course, don't put any stimulus on the bottom of my foot because it makes me feel weird.
Yeah.
And
But then you end up having that same kid is like hyperkinetic. They're constantly moving and moving, which becomes a problem when they're in school because you have to sit down and be quiet, and they don't interact with their environment appropriately, so they can't sit still. They're not having bad behavior.
Yeah.
Right.
They
And
just
it's not
can't
ADHD.
sit still. It's not ADHD.
Yeah.
Medication is not going to fix the problem. You're just going to kill their brain.
Yeah.
So let's help these kids actually grow up and thrive to be healthy
Instead
adults.
of like me, just finding little things throughout your life where you have to play all these little games with yourself every day to get through the day to manage the symptoms of that.
Right. And I think more people, more adults
parents.
have these issues unbeknownst to them.
Right.
And again, we talked about this before when we were talking about like chronic conditions and like why certain people are affected. There's so many reasons. We really don't know how a particular patient got there, but if early on you don't integrate those reflexes, your interaction with the environment and your world around you is not appropriate. You can learn to compensate, but at a certain point, maybe you sustain a head injury. Maybe you're exposed to some type of like pathogen. You add all these layers of like insult to the body, eventually those compensations can only do so much.
Right.
And then you end up with dysautonomia, gastroparesis, all these chronic conditions and diagnoses. There's so many different things that play into it. It's not just one thing.
This is so good, guys. This is so educational. So I'm glad you brought her, by the way.
She's smart.
She's all right.
As a parent, if you're listening as a parent or soon to be a parent, take that's good advice. Take your kid. You can do the follow up, right? You check for jaundice. You do all that
of
stuff.
course.
You might as well take them to the chiropractor as well.
Yeah.
And just for like any of the parents out there listening, I'm not saying this from just a clinical perspective. I, like Dr. Andrew and myself, we have 3 children, so we've done this with our own. There's a lot of factors that play into it. I'm thinking of our middle in particular. I had natural vaginal deliveries with all 3 of my children, and no complications, like no interventions, nothing like that.
Knock on wood.
And knock on wood, right? So, my birth with my second was extremely fast. 4 hours start to finish. I mean, I went from like 20 minutes apart contractions to 5 minutes apart to a minute apart to like, oh, you're fully dilated. Like, we're having this baby right now.
Yeah.
shot out of me so fast that he actually, we
Yeah.
didn't realize until about age 3 that he didn't integrate that spinal collant reflex. He ended up, he was not a great sleeper. Always kind of woke
Always
up.
fidgeting.
He would wake up
Claire.
screaming or like startled in his sleep a lot. And we didn't realize that this was going on. And around age 3, we paid attention to it. We noticed it. We're like, this isn't just like,
Night terrors.
yeah, exactly.
Right.
It's not just an
exactly.
uncomfortable kid.
He's
Yeah.
not just,
Yeah.
he's not, there's something going on. And it ended up causing a vestibular issue in him, which fortunately, Dad
Oh,
treats those things.
man.
So we
Yeah.
do vestibular work on him, and now he sleeps through the night.
Look at that.
That
And
is
guess what? We
great.
didn't need to use melatonin.
That's my youngest daughter. Similar story. I went to my appointment and she said, "You're like 2 centimeters. You're probably not having this baby at least in the next week or whatever." I went right to a restaurant from there. An hour later, I was going to give birth.
Yeah.
And it happened very quickly within 4 hours, 5 hours, the whole process.
Yeah.
Same thing. And that particular child of mine
And it's
needs
interesting.
a whole lot of stimulation. She will read a book while playing a game, while
She has to
listening to
convince
music all at the
herself to
same
go to
time.
sleep.
Yeah.
Yeah.
Yeah, her sleep schedule's awful.
And
Yep.
At 20 years old.
it's interesting. I do this all day long, and as a parent playing a different role, I was like, why won't he sit still?
Yeah,
All
yeah.
of a sudden, everything that I think
It
about all day
does
long is
work that
gone.
way.
Gone.
Yes.
Yeah.
Man,
Yes.
why won't he
Yeah,
eat his
yeah,
food?
yeah.
And we have 3 boys, so
Oh,
boys
let's go.
and girls are
Yeah.
very different.
Oh, yeah.
Yeah.
Our lives are constant movement, and I
Yep.
think that's a really hard thing too when we talk about like ADD and ADHD. Little boys are not meant to sit still.
Right.
They're
Yeah,
not
I know.
meant to sit still. They're supposed to move. They're
Yeah.
they're kinesthetic learners. They have to interact and
Yeah.
touch things. So he doesn't have ADHD.
That question you
No.
asked earlier,
Yeah,
are
about
we
what-
different
yeah,
neurologically?
about
Yeah.
neurological. Well, with my son, right, for 1 year old, I get a call from daycare. Hey, man, your kid won't stop running around.
Yeah.
And I'm like, well, yeah, he's 1.
Yeah.
Like, that's what they do.
Yeah.
Like,
Right.
I don't know
No,
if you met them.
But a 1-year-old girl
Yeah.
will sit down and color.
Right. Well,
My 2-year-old
Yeah.
son,
Yeah.
if I gave him a crayon, it's on the
it's
walls.
on the wall.
Or
Right.
he's,
It's
or
everything.
he's eating it.
Like
Yeah.
or
Yeah.
he's eating it, or he's
Right.
coloring on himself.
Yeah.
Like
Well, how does this work?
different,
Yeah.
exactly.
Uh,
He's trying to figure out how he can interact with his
I've
environment.
always said, once I knew I was having we were having a baby, we made a pact: no medications, no matter what. Like, we're gonna figure something else out. And thankfully we never had to, but they tried.
Yeah.
Yeah.
They tried, right?
Yeah, they do.
Hey, he's running around. He needs a pill. Like, nah, man.
No.
Yeah.
And how old is he now?
18.
Yeah.
18.
Look at that. He made it
He made it
through.
through.
Yeah.
Yeah, I know, man. The kid's amazing. He's a football player. He's big. He's
That's
healthy. We won't have really much issues,
Yeah.
thank God.
Yeah.
But they tried.
Yeah.
They tried.
Sure.
And Mom and I were we were on the same page, and I'd try anything alternative before I gave in to go ahead, give him a pill.
Well, and as the parent, it's exhausting.
No, it is.
You
I was
literally,
ready.
like, if you have little boys, you get to the end of the day, you're just like, please go to sleep.
Yeah.
I want to go to sleep, please. I'm so tired. And they're
Yeah.
they're healthy.
They're
So they're
healthy.
moving, and that's what they do. Like,
Yeah.
that's just how it is. They don't need medication. Just
No.
let them move. Get them
Right.
outside. Stop putting them in front of an
right,
iPad.
Right.
And that's
That's
been
a big
like,
thing.
yeah, that's
Parenting.
for sure. And that's been like a huge learning experience for me.
Yeah.
We grew up very differently. She grew up, doing things the natural way.
More
My
holistic.
dad's a cardiologist, so
Oh,
he
yeah.
it was medicine all the time.
Wow.
And so like when we met, there was a little bit of,
Yeah.
Yeah.
we'll call it conflict.
Yeah.
But
Two worlds,
But
two
it's-
different
yeah,
worlds.
I get it.
collide.
simply what I had grown up with and what I was used to. And then we had kids. And then all of a sudden you see this perfect little thing that is untouched, untoxified,
Yeah.
and thriving. And then I had to reevaluate everything that I knew about everything. And I said, I don't want to do anything
You had an
to
awakening.
spoil
This
this
thing.
perfection here.
Yeah. Right.
And I'm gonna I defer to her more often in the beginning, mostly
Yeah.
because I was nervous and,
Yeah.
and whatnot. But honestly, like going through that process, it's taught me a whole lot about how much more resilient we actually are, and how much more resilient we are than we're led to believe.
Yeah.
Yeah.
So it's like
They're so fragile. They're so this meanwhile.
exactly. But
I have the weirdest analogies, like the methane one
Yeah.
I used earlier. But like I used to have a saltwater hobby, so fish tanks for me. And when you set up a saltwater fish tank for the first time, everybody will tell you it's so difficult. You really don't want to get into this. It's expensive. You have to change the water once or twice a month, change 50%. No, you don't. It's an ecosystem.
Right.
Let it do its thing.
Right.
The more you leave it alone, the better off it is.
Stop intervening so much.
So same thing with the human body. But
Yeah, absolutely.
Well, and like you had said before, I don't know if you said it while we were recording, but birth and pregnancy is not a condition.
no,
It's
Not
a
a medical
process.
it's a natural process.
It's and we don't allow the process to happen.
Yeah.
And I
We
think,
have the highest mortality rate in the world, do we not?
right.
Infant
And,
mortality rate?
yeah.
Wow.
And a baby is not a parasite. It's something that those bodies are meant to
Well,
do.
well, unless
maybe.
you're Rh negative, they will make you believe your
Fair.
baby
Well,
is a parasite.
yes.
Yeah.
So, I mean, also, too, the birth is not a medical condition.
Yeah.
And I think for all the women out there who are pregnant or thinking about like having children, you can give birth to this child. Your body can do this without any intervention.
It's meant to.
It's meant to. It's designed to. And again, this goes back to education. We're not taught how the birth process works, how pregnancy works, what to expect. We're just told, well, it hurts a lot, and don't worry, there's
And look
medication
at all the things
for
that
it.
could
Right.
go wrong.
Right.
Yeah.
They'll give you an epidural. You'll be
Right. Absolutely.
But
Absolutely.
even pain in that birth process creates chemistry changes in the mother that allows her to start nursing, that allows her to start doing things that
Brain
are
shoots
appropriate.
off a lot of like
Right. There's adaptation
dopamine
that
and-
happens. Yeah.
Being a mother is uncomfortable and painful.
Yeah.
It is the hardest thing I've ever done in my entire life.
The hardest thing
Going
to do.
through natural childbirth, I believe.
Yeah.
Now, this is like not from
I
a
was
medical,
asking
not
them
from
to
a,
let me die. Yeah, I
not
was.
from a, this is not from a clinical perspective. This is me personally as like a mom and a woman. It prepared my body for what to expect as a mom.
Not
You're
to
sleep-
once again reiterate the fact that women are badasses.
Oh, the reason why we're the ones that are carrying
Yeah.
children,
Yeah.
giving birth is because
Yeah.
if it was men, no
No,
offense, guys,
No.
the species would cease to exist.
They'd
We
be
see
too
how
bad.
you are when you
That's
have a cold.
Yeah, exactly.
The
Exactly.
human race would be
No,
toast.
but you know what? You
No,
guys
I
are
do
not
too.
designed to do that.
No.
We are. And I
Right.
think as women, we need to understand that.
Yeah.
Our body is amazing.
Oh, I do. I walk around now like,
You know what I did? I created human life, pushed it out, but you know, I
Yeah.
populated
Yeah.
the world.
Yes, our
Yeah.
body is incredible. It does something absolutely amazing,
Yep.
and I think we need to celebrate that
I
and
know.
understand
Yes,
it. And I think we
yes.
also need to know that yes, it's uncomfortable, but you can do it. That goes back to like the whole idea of society being like we don't want to feel anything, so we
Right.
suppress
Suppress it,
everything.
yeah.
yeah.
Pain is sometimes necessary.
Yep. You need it.
I'll be
You need it.
texting Jamie every
this-
week from now on as I'm in perimenopause. Like, remind me that I'm a badass,
But
please.
this is why birthdays, you see the kids, everyone celebrates the kid.
Yeah.
Yeah.
Well, I
Celebrate
always
mom.
Say, I
Yeah.
always say happy
I buy
push
mom
day.
the gift after
Happy
birth,
push day.
not
Yeah.
for the baby.
Instead of happy, I'd
Yeah.
say happy push day.
Yeah, the kid
every
didn't
year.
do anything.
Yeah. Just showed up.
Yep.
Started eating all our food. You know what I mean? Taking up all of our sleep.
Seriously.
Yeah, yeah.
All right, guys, we could
Yeah.
talk forever, but
Yes,
we're
we
going to
can.
round this up. I have 2 more questions.
Ooh, here we go.
One important and one kind of fun.
For each of them?
Together.
That's good. All right. The room.
So this is a question, or not even a question, a statement I get all the time. Channeling again. People who say to me, well, I don't know that they can help me. I'm glad they helped you. But, now they've been in the system for years, chronically ill, whatever the condition, whether it be dysautonomia, Lyme, mold, whatever they're doing, they all go together. Ehlers-Danlos syndrome. Again, I wish we're probably going to do an episode 3. I want to talk more about that.
I
Because
love a
again, like
recurring
you said
guest.
earlier,
I do.
syndrome, and I try to tell people that does not mean you are instantly doomed.
No.
It does not mean you need to be ill.
Right.
Okay? So me being a perfect example, they made me terrified to move again, and I ended up disabled for 7 years. I was diagnosed with Ehlers-Danlos syndrome, dysautonomia, I had POTS, all of it. And here I am now. I don't associate with any of those things. I am fine being active. I do pull-ups and push-ups and sit-ups, and I move, and
I saw you
I'm
do a
living.
backflip before.
I'm living.
How old were you when you were
headstands.
diagnosed with the Ehlers-Danlos?
Later, much later. I was 36, I believe.
So you lived 36
Roughly.
lives without the Ehlers-Danlos?
Yes.
Yeah.
Yes.
Like, affecting you?
Yes. Well, I had low back pain.
Sure.
Okay.
But I used to have large breasts. They disappeared after my spinal cord injury and breastfeeding 2 children. They're gone. Ho hum. Anyway,
That question.
no, I didn't have anything that was crippling me. I didn't have anything that I would have considered myself chronically ill or disabled until I had a freak accident, and
Right.
then things
So
happened.
that's that underlying condition
Yes.
that was fine, wasn't causing any issue?
And I do find the majority of people with Ehlers-Danlos end up getting that diagnosis after things start falling apart. How do things start falling apart? The majority of people I met, and I've met thousands of them over the years now, whiplash, concussion, and some other trauma. Could even be surgical trauma. That seems to be in every one of their pictures.
Right.
Sure.
So don't hang your hat on the Ehlers-Danlos. It's
Yes.
there, it's a part of it, but it's not the cause,
Yes.
it's not the reason, and it's not the thing that is going to end your life.
And I am an empath, and I am empathetic, and I mean to be compassionate, but when I say this, it needs to stop being an excuse.
Absolutely.
And it needs to be looked at just that way. It is a syndrome. It is part of your picture, but there are answers, and let's continue digging and getting these answers, like from you guys and my great grandmother, who I keep channeling with these hands.
I think when people come in with those conditions, you have to take a step back and say, okay, this is part of the clinical picture.
Yes.
This is the person in front of me. We have to make a decision at that point now on top of the exam to say, is this the cause of all your discomfort? Maybe. Is it relevant to this syndrome or to this current complaint? It may not be.
Right.
Or is it an incidental finding that you've lived with, and now all of a sudden we're seeing it manifest a little bit more because of other things that happen.
Right. And
we have to decide those things. Go ahead.
thank you for saying that, because my question was, the people that say to me, I'm glad it helped you, it might not help me. I've already spent so much money. I have no money for an alternative practitioner, is what they will all tell me, because they've been relying on insurance and the doctors that are within their insurance. Well, those doctors that are within insurance are following a system and a protocol, and you are a name and a number on a chart, and that is about it. And you're not getting to the root, and you just keep continuing to be medicated and operated on.
Yeah.
So my question is, for the people that keep saying, I can't afford somebody like Dr. Brodyn, I can't afford to take that path, I'm glad it worked for you. What do you say to that? Because my answer to them always is, I would spend $30,000 a year on Lyme treatment. That never helped me.
Yeah.
Over the course of several years, $100,000 on things that only made me sicker.
Yeah.
So in the short term, if somebody were to put out $3,000, $4,000, $5,000 or less to work with somebody like you,
Sure.
to actually receive answers, that's what I tell them. Look at it that way.
Yeah.
You're investing in your health. There's nothing more important.
I think for those patients, they also assume that my work with them ends when they leave the office.
Oh, yeah, it does not.
There are countless number of days off that I come into this office and read stacks of history. And so even last Monday, I have a tough patient who we're evaluating involuntary spasms of shoulder and neck.
Okay.
Lots of inflammatory stuff. She brought me 10 MRI discs. I looked at all of them. I looked at all of her blood work from the last 15 years and going like, it's all here. But nobody takes the time to look at it. And to me, that's not billable time. That's simply
Right.
me doing my due diligence based on
Research.
what... Yeah, I'm doing research.
Research.
Like, you've
Right.
given me information. I
Yeah.
want to know what that information is. And that's where the difference is.
Yep.
A lot of people with chronic conditions have stacks of info. I want to know every
And it's
word.
so layered. You are like the Dr. House of the chronic illness community. I mean, that is what your practice does, because it is an onion. It is layers. It takes a long time to become chronically ill, and it takes people like you who understand how to, peel those layers back and get to the root of it and help you get on the path
Right.
to
I want
wellness.
exactly. I want to look at trends. I want to look at where
Right.
did this start? How did it progress? What are the numbers? What are the
Yeah.
values? How does it fluctuate? on
And
my
people
end,
want somebody like you who puts the puzzle together, who can see the pattern and also takes the time and gives a damn.
and on the financial end, I deeply struggle there because there are functional neurology. I feel is like this kind of niche practice that
Right.
tends to be expensive if you do intensives and stuff like that. And I go back and forth for the amount of work that I do. I would love to be compensated for the time that I'm spending.
Right.
I mean, people text our office number up until 11 o'clock sometimes,
Yeah.
going like, "Hey, I'm having some issues. What are your suggestions?" I'll answer you. But
See
I'm
that?
not billing for that
It
time.
took me from 7 years of disability and almost dying to
Right.
living a normal life, happier and healthier than I've ever been, like worth every penny,
So-
if not more.
I'm glad you just said that.
Yeah.
Almost dying.
Yes.
For those patients who
Yes.
say, I can't afford to see a doctor like that, I've already spent all this money.
Yeah,
You can't afford not to.
exactly.
Because the other option is
Death.
your life.
and that is how I
and
ended
that
up.
is
Right.
it. And
following
here's the idea though behind what you're doing with like the podcast and like just sharing all of this.
Yeah.
Let's hope that more people
Yes.
get to see us before
Yes.
Yeah.
they drain themselves.
Yes.
And they've
Yep.
seen
That's the
5,000
point.
other practitioners.
That
Like
is my intent.
you
to help
don't
people
need
find
to do
you.
that.
Yes.
Yeah, come see us sooner. Don't spend the money on that stuff.
Yes.
You know, like
Come here
don't
first.
don't wait for it to be so bad. Don't have 15 different medications that you're on and keep adding more and keep adding more, but it's not working.
Yeah.
Pay attention and listen to your body. This
Exactly.
is not working. Let's do something different and let's change the narrative. I mean, it's honestly healthcare
Yep.
in this country as a whole.
As a whole.
People need to be more aware that they have other options.
Yes.
That is not your only option. You need to listen to what your doctor says, get another opinion, do
Yes.
your own research, look for
And that's
something
the
better.
power people lose.
Or
Take it back.
Take it to
Take it back.
another side of the medicine, right? So
Absolutely.
this doctor's saying this. Well, you know what? I'm gonna go check with this doctor too. Let me see. It may not be the same doctor, right? It's
Yeah.
And
Yeah.
people get afraid that they're like their hairdresser if they go to somebody else, like you're offending your doctor.
Yeah.
No, this is your
No,
health. That is your
no.
wealth.
And
you have the
and the
right
doctor,
to go get as many
including us,
opinions as you'd like.
We work for you.
Yeah.
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 The patient,
That's what-
we work for you.
Yeah.
Yeah.
You are the patient. We are providing you with a service.
Service.
You pay us, whether it's through your insurance or not through your insurance. You're
take care of
paying
you.
for it.
Yeah.
Yeah.
Yeah, and to that point, like that's where the paradigm shifts. Like you said, we work for the patient. When you establish that relationship with a patient, that I work for you, you need something from me. I'm offering you perspective and maybe a handful of tools.
Yeah.
Now we're in this together,
Yep.
right? You're giving me feedback and saying how good is the service that you're providing for me. I want that feedback.
Yeah.
If I'm missing the mark, we have to change something.
And
You know what I
every
mean?
person that's coming to you is making you better. You are learning because each case is individual and unique, and you're learning every time somebody comes to you.
Absolutely.
Yeah.
And the way POTS has tons of POTS patients coming through here, all with a similar collection of symptoms, all with a completely different history, all with completely different perspectives, all with different histories of
Yeah.
emotional trauma and a whole bunch of other things that play into it. It's all encompassing. It matters.
Yes.
Every detail matters. And
Yes.
we have to look at each of those patients and kind of find their way.
And with the POTS patients, like specifically in mind, that's part of the other problem with like our healthcare system is that every practitioner is so specialized that when you have POTS, you see a cardiologist and you see a neurologist, and the neurologist is only looking at the neurology and the cardiologist is only looking at the cardiac function, but no one's looking at how they're connected, and that's what we're doing.
That's what you guys
Yeah.
Yeah.
We're looking at how it's connected, and that's why people actually get better.
Yeah.
Because you're not just a cardiovascular system, and you're not just a brain and spinal cord.
Right.
Everything is interconnected.
And
The human body
and
is.
there are systems, again, this goes back to education again. We really never were taught about our body.
No.
Most people do not know you have an endocannabinoid system, a glymphatic system. There are
Super
things
cool.
that people, yeah, it
That's
is very
super
cool.
People don't even know they have a lymphatic system.
Exactly.
You're going way too far.
Exactly. So
That goes back to
Until
your
it's too
cranial
late.
synostosis.
Yeah.
talk.
We'll talk about that off. Yeah. So anyway, we could go on forever. You guys are amazing.
You
tried to
has
end
been
this like 2 times.
I know.
Any more like ending questions, or are we good here?
No, I have our fun question I'll end with, unless you guys have anything else you want to put out there that you think is really important that we didn't touch on.
I feel like we could dive into everything all the time.
Yeah.
Part 3. Tune in.
I just want to say really quick, if you're out there and you're listening to this and you're suffering with some type of chronic condition and you are miserable and unwell and having a tough time, don't give up. Yeah. Try something different.
Yeah.
Just there's not a lot of functional neurologists out there, but there are enough.
Yeah. Right.
And you can find answers and you can get better. I really truly do believe that. Mm-hmm. You just have to end up in the right place. And we're one of those places, but there are other places, and we want to help as many people as we can, but if you're not local to us, we will help you to find somebody in your area that can help you. If we can't, even on a remote basis.
Yes.
There are a lot of different ways that this can work. Don't not call because you think you can't afford it or because you think it's not the right thing for you. I spend hours on the phone with new patients talking to people, and we don't charge them for that.
Yeah.
Just explaining the process and how this works and that we can help you, but you got to give us a shot.
Yeah. I think we're all here with the same intent. We'd like to educate people and help people be well. And to that point, yes, if you're afraid financially, just they can call or email you and you will let them know if you think you could help them or not. Let's just start there. And that doesn't cost anybody anything. So.
Absolutely. And the other thing I always say this to new patients is we don't ever promise you anything.
Right.
Because we don't know.
Right.
We have a very high success rate, and 99% of the time, I would say, like, we are able to get a result. Most of the time, that if we don't get a result, honestly, it's patient compliance. They're not doing what they're supposed to. It's not that we can't help; it's that they're unwilling to try and do the work.
Yes.
And initially, I think it's important that all progress starts by telling the truth.
Yeah.
Right? Mm-hmm. So we have to have an honest discussion about what's going on, what habits are, what we see.
It's okay to tell your doctor, hey,
for
I
sure.
just did an 8-ball of Coke.
Yeah, please.
For sure. I want to know.
Tell us what's going on. We're not judging
matters.
you.
Yeah.
And there have been instances where something comes in the first visit and I can't help.
Yeah.
Right? And we have to have that talk honestly up front and to say, like, you know what, this is not the place for you. And that's a good thing.
Yep.
You know what I mean? I may have perspective of where you may need to go next. But like I said, all progress starts by telling the truth. Let's have an honest discussion. Let's first see if this is a good fit and whether or not this is going to work with what you're looking for. And then we can go from there.
And I think, speaking of good fit, it is a good fit for you if you first believe that you can heal. I think that is very important to start there.
Mindset is everything.
Yes.
It's everything.
So
I just got a text like 20 minutes ago, and it's from somebody that we've been working on with POTS, and she texted me, I can lay down, I can lift, and I can sit up with no symptoms, and I'll never thank you enough for it. And that's awesome.
Right
that's the simple stuff.
Yeah.
But I mean, that's awesome. That's
amazing.
what it's all about.
Yeah, I mean, at the very foundation, you guys are helping. You guys are helping put people on a path where, you're giving them a set of tools that can stabilize them, if you will. And then I can speak from experience. I took those tools and I expanded on that. I went and I did trauma therapy, holistic trauma therapy, which entailed art therapy, which is very helpful in my case. I then went and studied under a mystic, and I did a sacred yoga practice. And there are many things that people can incorporate in their healing journey, but functional neurology and, addressing nutrition, the gut biome and those things, that's part of your foundation. Start there, and then you can incorporate the other tools. Build your toolbox. So,
and more importantly, it's important for us to give our patients tools to help themselves. Because getting good at the exercises I've given you is not the goal. It's time to get back to life. And so even afterwards, things come up. They get sick. Sometimes they bump their head again.
Right.
I want them to have the tools to know what to do when. They can always check in. how to make that better immediately for themselves, and that I think that's empowering.
Yeah.
So.
And, again, this could be another episode, but people ring their bell. They hit their head and don't realize the gradual or long-term effects of that. They might not even remember hitting their head.
Yeah.
But, yeah, it's important. So, it's time to wrap this up because it's gone on forever, but it's been so educational that I'm okay with that.
Cool.
I hope that.
Great. It's a good 2 hours spent well, for sure.
It's been that long?
For sure.
Yeah. A little bit longer, but no, it has so much information.
So much.
So
much.
Cool.
So grateful for this.
Like,
but just a fun little question to end it on a fun note. We did this on our last episode, but drink, dinner, and dessert. What is your death row meal?
Oh, death row meal.
Huh. Seltzer, because I don't drink alcohol.
Okay.
Cheeseburger all the way.
Yeah.
Dessert, I would have to.
Not even on the way out. You're like, you know what?
Yeah, no. Nothing.
No, honestly, like it makes me dizzy or whatnot.
You're dying. It's fine.
Yeah, be dizzy.
Not in a fun way. Not in a fun way.
Okay.
Yeah.
Okay.
So just like I want to kind of like I want to milk every ounce of that life.
All right.
And then dessert. I don't know.
Ooh.
Probably mint chocolate chip ice cream.
Nice.
Yeah.
Oh,
Nice.
wow.
That's a good one.
Just
is it though?
simple, but
mint chocolate chip.
So no
like
alcohol,
brushing
no
the
nothing.
green one though, not the white one.
What could we do in place of alcohol for him? You need to do
Nothing.
something fun on your way out. Are you a prankster? Do you want to pull something? What do you want to do?
I don't know.
Prankster.
I don't know. I'd honestly want like a lot of quiet. Just like
Okay.
let me look out and like
You'd want to sit
sun-
in nature and
sun,
just, like,
mountain, trees, breeze,
There you go.
nice weather. Like give me a
Okay.
minute and like let me soak up all the awesome.
Let your mint
All
chocolate
right.
chip.
There you go.
Fair enough.
Yep.
How about you?
So I don't drink either, but on the way out, definitely like a shot of whiskey.
There you go.
Yeah, me too.
Yeah.
Yeah.
Meal? I don't know. Probably like some type of steak.
There you go.
And then dessert? I don't know. Probably cheesecake.
Yes.
Ooh.
Okay.
Yeah.
Yeah.
I like cheesecake. Yeah. And
Last meal? Yeah.
But one of God's precious animals, right next to the mashed potatoes.
Yeah. I don't know. I'll skip the mashed potatoes. Just give me the steak.
Actually, since you guys are holistic practitioners in this realm, if I were to ask you if there's one thing that you really enjoy for your sanity or for your health, what is something you do, either on a daily, maybe weekly basis, something for yourself that really is part of your own healing or grounding practice?
This is gonna sound strange. I go skateboarding once or twice a week.
Not strange.
Not strange.
And I will spend 2 to 3 hours at a time because it's humbling.
Yeah.
It's always hard. It's never easy, and it allows me to, I don't know, just learn in a different way and just say like, what is my capability and whatnot. And honestly, going through that process that's a little bit more physical and cerebral helps me get out of my head here.
Okay.
I mean, I used to be more of a runner before
my
having
best bud.
children. And running would
our
definitely be
40s.
something that would like help me clear my mind, but probably now just life is so hectic that I would just want to I just spend time outside when it's nice out. I take my shoes off.
Yeah.
And just enjoy being outside because like we talked about, I mean, we spend so much time inside under fluorescent lights and just being stressed all the time and just being in nature. And that is like one of the best things that you can do for your overall health.
Okay.
And that's definitely like my go-to.
So
There you
basically, she said, touch grass.
Yes.
Get
With
outside,
bare
Get
feet.
outside and
With
touch
bare
grass.
feet.
And for the people who don't understand that, there are documentaries out there, grounding, movies on grounding you should go look into. But, all right, guys, this has been amazing again.
Thank you for having us.
Yes,
This is
thank
always
you.
fun.
I'm glad you were here, Jamie. You were a valuable asset to this. I mean, he's all right, but I mean, I think you were the star.
No, it's-
We don't want his head
No,
to get.
he
He's
picks
just
well. He picks well. Look at
no.
Yeah.
this. The
I
man-
mean,
the man's on fire.
I'm lucky.
Yeah.
That's what happened.
He's the brains.
he's just saving and changing lives. It's no big deal.
But honestly, like with all of our patients, it's not just one-sided. It requires us both. and
Yeah.
having that different perspective and that different passion on either side just helps us be more effective.
It's magic.
So I'm
One of my
grateful for it.
favorite words. You guys are magic. Seriously, what you're
Thanks,
doing is phenomenal. And I'm thankful that you did this. So thank you for being here. I'm grateful. I hope somebody out there was inspired, educated, or elevated today. This is another episode of E to the Fifth. I'm Steph, and thank you for listening.
And
That was a long one, but there was so much.
that's a lot.
You've been
So
trying
much
to close
good
it for like
info in
25
there.
minutes.
No, it's good.
You know what, you can
It's